Before we call this meeting to order, we'd like to start with a land acknowledgement. The West Hollywood Human Services Commission acknowledges that the land on which we gather, and that is currently known as the City of West Hollywood, is the occupied, unceded, seized territory of the Gabrielino Tongva and Gabrielino Quiche peoples. With that, we will call this meeting to order at 5:31 and begin with a roll call.
Commissioner Borelli.
Present.
Commissioner Ayers.
Here.
Commissioner Palmieri.
Here.
Commissioner Steele.
Present.
Commissioner Wyville.
Here.
Vice Chair Williams.
Here.
Chair Adolphson.
Here.
We have a quorum.
Great. Folks will join me in the Pledge of Allegiance. Great. Next up is approval of agenda. I believe we have a couple of things we want to add. Commissioner Borelli?
Thank you, Madam Chair. I'd like to, before we approve the agenda, I'd like to ask that we adjourn tonight's meeting in honor of two people. The first is Sandy Hutchins, who was a longtime member of West Hollywood's sober community, was a sponsor for many people, including somebody very close to me, was very involved, and especially in the early days, and I believe chaired the Van Ness Recovery House, and was a very active businessman and associated with the West Hollywood Chamber of Commerce. So I ask that we adjourn in memory of Sandy Hutchins. The second one, Jewel Faiz Williams, passed away. I think many folks would know Jewel from Jewel's Catch One, the amazing dance club. Many people call Jewel the mother of Black LGBTQ Los Angeles. She also helped start the Minority AIDS Project and the Village Health Foundation. She was a real pioneer and trailblazer, and I ask that we adjourn in memory of Jules tonight. Thank you.
Thank you. And I know Vice Chair Williams, you also wanted to say a few words.
Well, I knew Jewel Williams personally, and as the only woman of color on this commission, I wanted to say that we should do this commission in her honor and close in her honor. Jewel Williams was a true champion, a true leader. She was a woman who led with her heart and her mind and no ego, which we can't say about a lot of people in our world right now. So Jewel Williams, thank you for being my hero, my shero, and someone who was always kind to me and always offered help when I needed it for the community. So yes, I would like to honor her at the end of this
Thank you,
session.
Vice Chair.
And with that, move to approve the agenda.
Oh, hold on.
I think we have one more thing.
Sorry, commissioners. There is a slight typo on there. We are supposed to adjourn to our next meeting. It has the wrong date on there. It has the 15th. We're not meeting next week. We're going to meet July 22nd. That's
Great.
my only edit.
Thank you, Amy. So with those adjournments and the amendment, do I have a motion to approve the agenda?
So moved.
Second? I'll second.
Thank you. I have a first from Commissioner Borelli and a second from Commissioner Ayers. Roll call, Commissioner Borelli.
Aye.
Commissioner Ayers.
Aye.
Commissioner Palmieri.
Aye.
Commissioner Steele. Aye. Commissioner Wyville.
Aye.
Vice Chair Williams.
Yes.
And Chair Adolphson.
Aye.
Approved.
Great. Moving on to the approval of minutes. Is there a motion to approve the minutes? So moved. Excellent.
Seconded.
Second?
Yes.
Commissioner Wyville, thank you. Roll
Okay.
call.
I have a first from Commissioner Ayers and a second from Commissioner Wyville. Roll call, Commissioner Borelli.
Aye.
Commissioner Ayers. Commissioner Palmieri.
Aye.
Commissioner Steele.
Abstain.
Commissioner Wyville.
Yes.
Vice Chair Williams.
Yes.
And Chair Adolphson.
Yes.
Approved.
Great. We have several public comments. So we will move into that. The Human Services Commission values your comments. However, pursuant to the Brown Act, the Commission cannot take action on items not listed on the posted agenda. Members of the public have 3 minutes to speak. This public comment period is to address the Human Services Commission on agenda items or items of general interest within the jurisdiction of the Human Services Commission. An additional public comment period is offered at the end of the meeting. So with that, we will begin with Yola Dore. Yep. We will move to Tali Peretz. I hope I pronounced that correctly.
Good evening. My name is Tali Peretz, and I'm proud to be here on behalf of WISP, a woman-founded safety tech company built around a bold but deeply personal mission to bring confidence, clarity, and control to every night out. WISP was born out of a growing need, one that's become impossible to ignore. With drink spiking on the rise and often going undetected, people deserve real tools that they can trust. We've heard the call for safety solutions that aren't just reactive, but proactive, real-time, discreet, and designed to fit into everyday life without disruption. At the heart of WISP is a small but powerful tool, a portable device that tests for common drink spiking agents like GHB and GBL in under 10 seconds. It's fast, intuitive, and private, giving people the information they need in the moments that matter most. But we're not just building a product, we're building an ecosystem of support. Through the WISP app, users can log and store results, flag suspicious activity, and even trigger SOS alerts if they feel unsafe. And soon, we'll be introducing new capabilities like alcohol and sugar detection to help users understand their own patterns and feel better and safe the next day. Because wellness and safety shouldn't start when the night begins here in the city of West Hollywood. We're already piloting WISP across college campuses and community spaces here in Los Angeles in close collaboration with student leaders, health advocates, and public safety allies. Our goal is simple: to not only respond to harm, but to actively support both safety and wellness through technology that is accessible, empowering, and rooted in everyday care. I'm honored to be joined here tonight by Sophie Golshani, one of our incredible student ambassadors here at USC, who has also been leading on our on-campus efforts. She'll share more about how WISP is being used by students in real time in Los Angeles and the real impact we're seeing already. Thank you again for welcoming us into this space, and we're excited to keep building this future smarter, safer, and stronger, and we hope to do it together in the city of West Hollywood.
Thank you. Next up is Joey Backrack. Oh, no, we'll go Yola. Yola, come on up. Sorry, Joey, you're next.
My apologies. Yola Dore, 30-plus year resident of West Hollywood. Good evening, commissioners, staff, and honored guests. This evening, there's a lot to say because so much is happening in our country and in our world. We've always been able to take care of our WeHoans. We've always been able to take care of our own. But this year, we're challenged. This year, we need all the help we can get. The cuts will be so much for the disabled community to bear. So many will not be able to get the medical help they need. So many will lose their doctors. So many will lose their health. We can't use cod liver oil to protect us against the measles. We have to have those vaccines. We have to speak loudly. We have to write letters. We have to back the people on this commission and the staff that helps them and help them do the job that they do every time there's an RFP. I am so proud of you. I thank you so much for your service, all of you. We're here for you because we know you're here for us. Thanks.
Thank you, Yola. Next up, Joey Backrack. followed by Russell Yakarin.
Hello, good evening. I didn't have anything prepared, but I'm Joey Backrack representing Rainbow Hill Recovery on behalf of myself and my husband, Andrew Fox. We are an LGBT-specific treatment center in Miracle Mile for primary mental health and primary substance use. And we're applying for the RFP because we scholarship quite a few residents and people part of the community who otherwise wouldn't be able to afford good quality care. And we wanted to open Rainbow Hill Recovery for our community, by our community, because all too many times we've heard from our clients being promised one thing, getting something completely different when it comes to cultural competency and our, I don't know how much time I have, but being asked questions they shouldn't be asked when it comes to who they are, how they identify, what surgeries they've had, and not really focusing on the individual when it comes to treatment and recovery. So we're applying for this in hopes that that we're able to service more community members. So yeah, okay, thank you.
Russell? Is it Ibarra? Now I can
Yes,
see
yes,
it.
you got
Thank
it.
you. I'm sorry about that.
Hi, my name's Russell Ybarra, patient advocate for Capital Drugs, and I'm representing Raja Zanetti and myself. We put in an RFP with the West Hollywood, City of West Hollywood, and we're very honored. We're looking forward to the opportunity of providing PrEP since we have the West Hollywood testing center closing. We're hoping to step in and fill that gap. We know testing is very important, so by having that service in Capital Drugs where anybody could walk in, receive that service or schedule an appointment, I think will be great for the City of West Hollywood. So we look forward to working with you in the near future. Thank you.
Thank you, Russell. Sophie Golshani, followed by Rodney Prakasan.
Hi everyone, my colleague Tali Peretz introduced me earlier and I have my Whisper device with me today. We had the privilege of speaking about WISP to Karen Aris at the Women's Advisory Board earlier this month. I wanted to introduce myself again. I'm Sophie Golshani and I've had the opportunity to work with WISP from the ground up and watch the company grow as they've partnered with organizations and communities around the world, completely transforming their cultures. I'm a rising senior at the University of Southern California, and through talking with friends on campus and at other universities around the country, I've realized just how significant of a threat drink spiking has become. For example, I lived in a quad last year with 3 other girls, and 2 of them have had their drinks spiked more than once since the beginning of college. The first thing we think about whenever we walk into any event is to never take a drink from a stranger and to watch yours at all times, which leaves us scared, defensive, and vulnerable. I was able to lead WISP's partnerships with various sororities, including my own, at USC and across the country, and I have been able to witness firsthand the incredible impact that WISP has had on the culture of our campuses. WISP is the most advanced drink spiking detection technology that will exist on the market. It has helped countless individuals feel more in control of their safety, health, and wellness, all while increasing positive connection with those around them. But through the pilot, I've seen that it is more than a piece of technology. It is a movement. In the face of some scary realities in our world today, it encourages us to be proactive. WISP has empowered me and countless members of my community to lead spaces with more trust, courage, and confidence. And I'm very excited to get the opportunity to share the movement with you all today. We're here to bring awareness that a product like this exists. It can truly save lives, and we hope to see it in bars and venues across West Hollywood. Thank you so much for letting us come speak to you.
Thank you. Rodney Prakasan.
Hi, good afternoon. What's going on now in our society is confusing sometimes. We don't know what tomorrow holds for us, so we have to stand together no matter what the situation is, because we're all brothers and sisters, all of us. So we have to come forward and voice our opinions for what's right. Thank you.
Thank you. Eugene Maskey, followed by Laura Duncan.
Good evening, Chair Adelson, Vice Chair Williams, commissioners, and city staff. Thank you for welcoming me into your space and allowing me to provide you with this quick update. I'm Eugene Maskey, West Hollywood Tenant Outreach Organizer for CES, Coalition for Economic Survival, a 52-year-old multiracial, multicultural, grassroots, community-based organization, nonprofit organization, assisting organizing and empowering low and moderate income renters in West Hollywood, Los Angeles, and all of Southern California. CES helped create the city of West Hollywood, led the effort to win rent control laws in West Hollywood and Los Angeles, and most of the local laws that still protect tenants to this day. We are serving residents in West Hollywood and protecting tenants' rights, and Coalition for Economic Survival is requesting funding to continue a city-funded West Hollywood tenants' rights, tenant outreach and educational program to inform renters of their rights, to prevent unjust evictions, to provide protections against illegal rent increases, to preserve rent-stabilized units, and to secure safe, healthy, and habitable housing conditions. Working with priority populations, we pay attention to community feedback to provide holistic solutions, valuable and unique services that each and every member of WeHo community can access, easily access. We work now in 6 languages, and we provide access to all services to people with different abilities, and we make sure members of monolingual communities and people experiencing digital divide can access all our services at all time. During our Wednesday night or Saturday morning CES Tenants' Rights Legal Clinics, we provide one-on-one individual legal consultations with the best tenants' rights attorneys. When I started this job, I quickly realized some of the issues may be outside of our scope of work, even though I work tirelessly because it's a passion project. So I started building care circles, working with other community partners. Now we work closely in cooperation with multiple nonprofit partners like JFS, National Council of Jewish Women, Alliance of Housing and Healing, Trans-Latino Coalition, APIT, JVS, WeHo Works, and other agencies and organizations servicing the diverse WeHo community. This is how we at CES see the holistic approach to our work, to service to our community. And together we can fight the inhabitable conditions and help our residents. Thank you so much for your time.
Thank you. Laura Duncan, followed by Stephen Trapasso.
Good evening, commissioners. I'm Dr. Laura Duncan, the Executive Director for Essentia. We are a comprehensive homeless services agency serving all parts of LA County, but headquartered in Glendale. That's where we started. Essentia considers it to be an honor to collaborate with the City of West Hollywood. In 2016, we contracted with the City of West Hollywood for the first time, and that was after the city had done some research into what we had going on in the Glendale area and the surrounding areas. And they were reportedly impressed with our outcomes and our successes. So we were encouraged to apply for the first time at that time. Through our partnership, we significantly impacted and even saved many lives. The Essentia team not only provides outreach services, street outreach and engagement, and referrals, but we bring the case management to the people where they're living on the streets. Recognizing the importance of community connection and support for West Hollywood community members, We provide that direct assistance, case management, referral services, as well as connecting community members to various housing solutions, primarily and starting with our street outreach teams. We also connect individuals who are seeking emergency or interim shelter or housing to our emergency housing program in Glendale. We have 10 beds there for WeHo. And community members who are seeking that are also provided and staying there. Ongoing case management, housing, they develop housing plans, income development plans, housing navigation and retention services once the permanent housing is secured. We hope to continue this successful partnership and work together to find solutions that will lessen and one day end homelessness. So initially, we were providing the street outreach services, general case management, the 10 emergency shelter beds in Glendale, and we averaged in that first 3 years placing 17 people per year in permanent housing. And our housing retention rate, by the way, is about 97%. So it works. The other thing is, in 2019, when we renewed, we added a housing retention specialist because we now had like 70-some people in housing, and it was too much for our existing case management team because they were continuing to keep housing people. And so we brought that on, and we still have that. And then in 2021 or 22, with the next renewal, we were asked to add a second street outreach team for the swing shift. Thank you. You got the idea.
Thank you, Laura. Appreciate it. Stephen Trapasso, followed by Joe Green.
Good evening. I thought I had 2 minutes, so I'm going to talk really slow. Is that okay? Good evening, commissioners. Hi, everybody. I'm Steve Trapasso, Executive Director of Seeds of Hope. Here to talk about the RFP we put in, where our program is now, and where we see it going in the future. For nearly a decade, Seeds of Hope has been delivering essential, high-quality services in the city of West Hollywood. Our free farmers markets provide residents with abundant, nutrient-dense fruits and vegetables. We teach people how to prepare healthy meals, how to compost their food scraps, and how to grow their own food. This full circle approach to food doesn't simply just feed people, it reconnects them to health and to each other. We know our clients and they know us, and some of them are here tonight. We're currently underfunded, but we show up every single week because the need is real and growing, and our neighbors are counting on us. At Plummer Park, what began as a pandemic response for just a dozen families has grown into a weekly distribution where we serve over 300 households each week. Today, we serve 320 households. This site operates entirely on Seeds of Hope's own resources, with no City of West Hollywood funding. In addition to fresh produce, at Plummer Park, we offer on-site social services navigation and housing support, helping West Hollywood residents stay healthy and housed. But as the needs continue to grow, so does the urgency for sustained investment in this program. That's why we're asking the city to invest in what's already working. With city funding, we'll restore our holistic model across 8 West Hollywood Community Housing Corporation sites and expand to reach 2 more. Those 2 serve disabled BIPOC residents, young families, and elderly Russian women. We'll also launch a second open access distribution similar to Plummer Park right here at West Hollywood Park in collaboration with the library. We had a little pilot program 2 weekends ago during the design symposium that was here. We had a table outside. We were giving out fresh produce and information about our programs here in the city of West Hollywood, and it was a great success. This will ease pressure on Plummer Park because about 20% of our residents that come to Plummer Park are actually coming from this side of town. So that's why we're proposing having a free farmers market here with all of those services I talked about. This expansion will help us reach approximately 5,000 extra West Hollywood residents every single year. Thank you.
Thank you.
And I didn't finish.
Appreciate that, Steve. Thank you. Joe Green, followed by Elizabeth Stevens.
Good evening, commissioners, staff, and members of the public. It's a pleasure to be before you tonight. I'm Joe Green, resident of the city of West Hollywood, member of the Disabilities Advisory Board, and co-chair of the LA County Commission on HIV. A little good news on the HIV front. The CDC came through and funded prevention, so that was some good news. And today we heard from our project officer from the federal government that we will be receiving our full federal funding for Ryan White, so that was some really good news. So thank you. With regards to your proposals that you're going to be reviewing tonight, I'm a volunteer and client with Being Alive. I know that their work is phenomenal. I was at Seeds of Hope today. I pick up food for my neighbors. What they do is phenomenal. I think doing that on this side of town would be great. And I know you have a lot of decisions to make tonight, so good luck and thank you all for your service.
Thank you, Joe. Elizabeth Stevens, followed by Oshri Hakak.
Hello, commissioners, and thank you for having me. My name is Elizabeth Stevens, and I'm honored to represent NAMI Westside Los Angeles, your local affiliate for the National Alliance on Mental Illness. Our nonprofit offers free, peer-led programs to individuals and families affected by mental health conditions. Our work includes support groups, classes, programs in schools, outreach at community events, and the creation of innovative mental health materials. We serve over 10,000 people annually, both in person and virtually. Our services are built by and for the communities we serve. We've seen firsthand how vital affirming, peer-led, accessible mental health support is, especially for those who are often left out of the mental health care system and other social services. In our RFP, we're proposing an initiative to expand our LGBTQ+ mental health programming in West Hollywood. That includes launching weekly queer peer support groups, training LGBTQ+ community members to lead these groups, and creating tailored materials like a queer mental health trifold that we will print in mass and an illustrated children's book on queerness and mental health. We will also do outreach in Spanish, distribute bilingual materials, and run support groups for families and peers in Spanish. I'm joined today by my wonderful colleague, Oshri, who will be speaking after me and sharing a bit more about our programs. We know that hope and healing happens in community, and this initiative is about building just that here in West Hollywood. Thank you for your time and consideration.
Thank you, Elizabeth. Oshri.
Chair, after this one, we don't have any more time for public comment unless you want to take in a few more, but we're at time.
No, I think that's fine. We can save them
Till the second public comment.
Okay,
Thank
great.
you.
Thank you.
Good evening. Thanks for having us here. And I'm going to make these 3 minutes a little more experiential. My colleague Elizabeth got to share a little bit about what we do. But walking backwards, I'm Oshri. I'm the school program coordinator for NAMI Westside LA. This past year, through our program Ending the Silence and our Children's Mental Health Toolbox, we got to reach about 5,000 kids from K to 12. And that was through visits, school readings, presentations, through a couple dozen different presenters, including myself, that we have. I'm going to give you first a taste of a question, and I'll ask for your participation. We have 2 minutes, plenty of time. The first question I like to ask kids when I present to them is, how many of you are aware of the sense and the experience of, I'm going to be a burden if I unload and I share what's happening inside of me with someone else, then I'm going to be a bother or a burden on someone. Anyone know that experience? I see some nods. And okay, this one, next question, I asked for true hand raises. Because then the question I like to follow that up with is, how many of you like to help if a family member or a friend or a classmate comes to you in need of support? And no, I like to say no elbows under your shoulders if you can. So if you like to be of support, I got some good participation here. Good. Usually everyone raises their hand. I know it's a little different, so maybe that's why we're getting a different response rate than in the classroom. I like to say look around, and next time you feel that you're being a burden or a weight on someone, people like to help. And our 35-second mindfulness meditation, I'm going to ask you to drop in, put your feet flat on the ground, and slow down and deepen your breath. And you're going to visualize roots coming down through your feet. And at some point, those roots go down far enough that there's a place where you cannot distinguish your roots from the roots of other people in the classroom. And when you're feeling confrontation, be it with a family member, friend, parent, teacher, drop into that sense of connection. Thank you.
Thank you, Oshri. Appreciate that. All right, are we good to move on? And thank you all so much. There's so many amazing comments, I think, still to come. Thankfully, we've also read your proposals, so we know the incredible work that you are doing, and you'll probably have another opportunity to come up and share more about the organizations that you're here to represent as questions come up throughout the night. So we will pause on public comments then for now and can bring them back up at the end in case you have something to say that we didn't ask you about or didn't come up in discussion. So with that, there's nothing on consent calendar, no public hearing, no unfinished business. And so, Tari, I give the floor to you to talk about our commission review of social services proposals.
Thank you, Chair. Good evening, everyone. Chair, Vice Chair, Commissioners, agency representatives, and members of the public. Tari Carter, Human Services Manager. Tonight's meeting is a part of the city's transparent public review process for the city's social services contracts. We also want to acknowledge that this meeting is being publicly televised, allowing community members to observe the process. To provide a brief recap, earlier this year at your April 8th meeting, the Commission identified priority funding categories based on several months of community engagement, including feedback from advisory boards and commissions. The funding categories identified were animal care, children, youth, and families, community connection, economic empowerment, health and wellness, homelessness services, legal, and advocacy. Following the identification of these priorities, the city released the request for proposals for social services contracts on April 25th. The application period closed on June 5th. At your June 10th meeting, the Commission formally received 47 proposals requesting nearly $18 million in funding, including 20 proposals for new programs. We are here tonight to provide the Commission with an opportunity to provide feedback and raise questions on the proposals under consideration. The process will be as follows. Each Commissioner will have 2 minutes to share their feedback for each proposal. Commissioners are not required to comment on every proposal if they choose not to. City staff will take notes of any questions raised during your remarks and those questions will be presented to the applicants after the feedback portion of the night. After applicants respond, commissioners will have the opportunity to ask final or follow-up questions at that time. This process ensures all feedback is heard in a respectful, fair, and transparent manner, allowing applicants to clarify their proposals for both the Commission and the public. The discussion tonight will help inform the Commission's final funding recommendations at your July 22nd meeting. Those recommendations will then be forwarded to City Council on August 10th, with final contract approval scheduled for September 15th. The new 3-year contracts are slated to begin October 1. Thank you again for your thoughtful participation and dedication to this process. I'll now turn it back to you, Chair Alderson, to begin the feedback process.
Excellent, thank you. Any questions from my fellow commissioners before we start the process? Yeah.
Thank you, Chair. I just want to say I always love the input from the public and from those here. I think format-wise, preferred that we had a little more opportunity to hear from folks. I think it kind of informs the questions and the feedback portion of the program. So I just wanted to say that for the record. I did go back and review all of the audio from the every advisory board and commission where this was presented. And so I wanted to hear the voices of those bodies themselves as opposed to something that was a little more condensed. And I think it was really fruitful to do that. I think hearing the voices of the community that serve our community in that capacity, that are bringing the voices of the community with them and taking a lot of time to provide really thorough feedback is very valuable and very important information. Some of the things that were kind of culled from that I think will lend itself to this, and I think it was feedback intended for this, so it's appropriate. But beyond that, I think there's some things for staff and for us to maybe look at process-wise that I think is already a tremendous process, but it was just exciting to hear some new kind of ideas and feedback. Incredible input from the Disability Advisory Board, from the Russian Speaking Advisory Board, and the Older Adult Advisory Board. So I really valued all of their input, and I will be factoring that into the entire process. So I just want to thank everybody for their time in serving.
Thank you, Commissioner Steele. Any other thoughts or questions before we begin? Commissioner Ayers?
Oh, thank you. So on the application form, there is a space for requesting urgent funding. Could you just clarify what the criteria is for urgent funding?
Hello.
Welcome.
10, 9, 8, 7, 6, 5. No, just kidding. Sorry, inappropriate. So when it comes to urgent funds during our RFP process and for our contracted agencies, that's just monies that are used for emergency things. Like it could help with paying a utility bill. It could help with getting some food, some groceries, just things that aren't generally covered under their service categories, but it's something that will help with the quality of life for the client, if that helps.
It does, thank you.
Commissioner Borelli?
I'm not sure that answered the criteria question, but it explained it a little bit more. My question for staff is, do we have a final budget for this cycle?
I don't have an exact number, but it's a little under $18 million.
No, the budget that the city is allowing us to...
I'm sorry, 8, not 18.
Thank you.
You got us very excited.
That split a whole different 8. Did I
We
say
were about
18?
to play Oprah up here.
8.
Approved.
You get a contract. 8.
8?
Yes, a little under 8.
A little under 8. Okay, thank you very much.
Great. Yeah, Commissioner Weibel.
Yes, one question. Could we do one more quick review of the calendar for the next 2 or so months before we begin?
Repeat the question? The review of the
Could
calendar?
we review the calendar for the next 2 months again? Someone said it, but I didn't catch.
Deadlines for
Yes,
for this?
that would be great.
I have the dates. So we have, what's today's date? Okay, so on the 15th, we have the evaluation scores due, July 15th. July 22nd, city staff and the commission will discuss funding recommendations. Monday, August 18th, city council will receive the funding recommendations. September 15th, the city council will receive contracts. And October 1st, the new cycle begins, new contracts. And we can resend out this to you all as well.
Yes, go for
So sorry. For the 22nd, can we get, between now and then, exactly what the expectation is going to be in terms of how that communication is going to happen, what the flow is going to be for us to work with staff to kind of deliberate on the funding, what we should come in prepared with. This could be an email. It doesn't have to happen now. But like, for example, I didn't know we were going to do 2 minutes for each thing, which is fantastic. Always happy to have some time, but just want to be very prepared for that. We're all always ready to talk, so don't worry. But for the 22nd, we just want to know exactly what we need to come in with, what we can, what's appropriate to come in with, and what needs to happen in that moment. Thank you.
Great, thank you. And the 22nd will be another opportunity for our providers to come in if they have any additional comments, correct?
Did we? Yes.
That will
Correct.
be public. Great. Anything else? Otherwise, we will begin. The first one, going in alphabetical order, and I just want to call out for my fellow commissioners, the document that we received before the weekend, it is alphabetical order, but it's by current providers and then by new providers, so we'll be going by the book. So the first one on that is APLA Health and Wellness, Housing Support for Seniors and Persons Living with HIV. We can begin going down the line or by a raise of hand.
These are going to be 2 minutes.
Commissioner Steele, do you feel ready to offer some feedback? If you have any, and also if you don't have feedback or questions, then it's fine to pass.
Yes, I will not have feedback on all of them, but I do on this one, so thank you for that and also offering it out for future commentary. One of the pieces of information that I got that I wanted to share was that APLA is actually tremendously good at offering support on the forms. I heard that from both the Disability Advisory Board and the Older Adult Board, and I thought I just wanted to highlight that service. I thought it was really important, and I'd love to see more ways for us to work with the city to build on that. Other than that, on the proposal, I don't have anything else right now, but I might come back.
Commissioner Palmieri?
I have nothing on this.
Great. Commissioner Borelli? Commissioner Ayers?
I'll say this once, but this kind of applies to all applications for existing services, asking them to continue. I'm inclined to improve those applications if they are if they have shown that they know how to do the work and they're adapting in the city. APLA Health is one of those organizations, and I'll leave it at that. But my simple reason for that is that if it's working, why replace it? Why mess with it? And why cause a breakage in care for the people that they are serving today?
Thank you. Commissioner Wyville?
Nothing to add on this one.
Vice Chair?
I'm going to kind of follow in the vein of Commissioner Ayers. I'm going to share this once, and it kind of covers all of the applications. I am very focused on female leadership and empowering women who are more than capable to be leadership. I am a little concerned about some of the lack of diversity was in some of the leadership, and I'd like to see more women empowered to be at the executive level and matching those salaries. Thank you.
Thank you. No comment for me on this one, other than I appreciate the inclusion of financial literacy programming to support the financial assistance grants. I think that's incredibly important in supporting sustainable change. So thank you. Next up is APLA Health and Wellness, West Hollywood Community Support Services. We're just going to ping pong, so I'm going to begin over there with you, Commissioner Wyville.
I also don't have anything to add on this one. Thank you.
Ditto.
My only comment is I'm a little concerned about the cost. It seems a little high to me, but it's definitely one I would consider recommending.
Thank you. Commissioner Palmieri?
Excuse me. So as most of you know, I hate to agree with Commissioner Borelli, but I think the cost is slightly high. I don't have a lot to say about this. I do want to dovetail on what Commissioner Ayers said. I appreciate all of the work that's been put into all of the RFPs. actuals mean a lot to me, so those that have been with us for a while, I sort of agree that if it's not broken, don't fix it. That does not mean that I'm not taking into consideration anything else. Please be aware of that. But I did want to say with that, I did want to dovetail what she said.
Commissioner Steele. Ms. Carter, is questions now, or are we going to do another round of that, or should we just do them?
If you have questions, we'll jot them down.
And then we can
We'll ask the
folks in the next
organizations to
round.
come up. Yep.
Perfect.
Okay, great, thank you. All right, so I have the number here of the client eligibility being at or below 200% of federal poverty level, and I was just wondering if we had numbers for West Hollywood on that. My second question is talking about the group level workshops and community forums, if we can have access to exactly where and how. I think that's one of the things that's come up repeatedly, and just kind of getting that information. So again, maybe not in this moment, but getting that information so we can invite folks in a larger path.
Can you ask those one more time so we can make sure we get them?
Yeah, gotcha. Okay. The first question was client eligibility states living at or below 200% of the federal poverty level, which is $15,650. I was just wondering how many folks in or of the West Hollywood community that applies to. And then my second question was in terms of the enrollment and insurance and the group workshops and community forums on information, insurance, and getting those things sorted, if we can look at the where and the how so we can help disseminate that information. And then I had one more here. Okay, so yep, and the key intervention components are we provide individual benefits and assistance, CalFresh, group level workshops, community forums. I was asking like where in West Hollywood specifically, and I also want to, yeah, thank you. And also I just want to make sure we're incorporating that information back out to the folks that are continuously asking for that level of support. If we have great providers, as we all stated, that are already providing some of this, so some of this will be a question for staff for us to get information and disseminate it back, and some of it will be for the provider. And then the only other question that I had is working with property managers. One of the questions we had was about emergency resources for our older adult population and for our disabled population. And so my question was, if it doesn't exist already, is there a way to work with our property managers, if there's a pre-existing program where they're working with property managers, to also help create a collective and a shared bit of information so that we can utilize that in evacuation and emergency response? Thank you. Classic.
Excellent. Vice Chair.
It's only $8 million.
Well, I'm going to agree with Commissioner Borelli and Palmieri. I'm a little concerned about the amount that's being shared here, and I'm curious about why the number's so high regarding the services here, but that's my only concern as of right now.
Thank you. And then my only comment on here is around food pantry. We've said this is probably more for staff and a procedural question because there are a lot of organizations that we're reviewing that offer food pantry services. And are there opportunities to, like, I don't know, pick and choose a little bit when some of these organizations, because APLA Health and Wellness has so many amazing programs that they're offering in this one proposal. So that was my only thought on that one. And with that, we will move on to Essentia, Street Outreach, Emergency Housing and Retention. Commissioner Steele. Commissioner Palmieri.
I have a few comments. I don't have any questions. Essentia has proven time and time again just how amazing they are with our community. I did go to Essentia when they first came on. I think it was 2016, and I walked through, and it was a beautiful place. It was spotlessly clean. It was more like a house than a shelter, if that's what we're calling it. And I sent someone there, and they were a very good trans friend and had nothing but compliments. They were not afraid. They were very happy with the service. They were very full with the food. That's not our experience with other places. So I want to throw that out there that Essentia does an amazing job, and I think we all see it.
Thank you, Commissioner Valeri. I'm doing great right now.
Agree with Commissioner Palmieri. My concern is that we have a lot of duplications across the board with outreach for our folks experiencing homelessness. I think I counted 6 in total. So while I really like and support Essentia, I'm very concerned about where we're at in terms of duplicative work and how we still struggle as a city and a society and our outreach providers with those who are seriously, chronically homeless. So I think we have to really think about that as we whittle these down to get into that budget.
Thank you. Commissioner Ayers.
I think Essentia is at the core of the city's work toward meeting, I don't want to say the needs of the unhoused, but finding resolutions and addressing what's going on with the unhoused population in our city. The city has a strong partnership with Essentia, with them handling the Holloway Hotel transitional housing. They have the means to not only give a shelter bed to somebody overnight and give them transportation to and from that shelter, but also find longer term solutions that includes the transitional housing program and other resources. I understand Commissioner Borelli's comments about redundancy. That is a concern for, I think, us and a lot of community members who see the city spending a lot of money on the unhoused. But the city is in the process of moving toward a more collaborative approach to these services. In recent council meetings, there have been the inklings of a plan, right? And right now, our Human Services Division is working with our Public Safety Division on a long-term plan for staff to collaborate more, and perhaps some of these redundancies can be reduced over time. But that's not going to happen right away. So yeah, I think there's going to be some overlap up front. And that'll give us some visibility as to how we can streamline and how our social service providers can work more closely together. But definitely Essentia, I think, is at the core of that, and they're primed for warm handoffs to other agencies.
Thank you. Commissioner Wyville?
Appreciate both Commissioner Ayers and Borelli's comments. I think I'd land somewhere in between the two of you. And Commissioner Borelli, I appreciate you bringing up the redundancies. It was definitely something I was thinking of as I was going through the applications, but wasn't quite articulating it. But I will also say to the earlier conversation about, bringing in newer providers or choosing providers where there may be redundancies, I'm not hesitant to doing so. The cost here does seem a little high as well, but this is a very service-intensive line of work. But I am also a little concerned about the ratio of connections versus permanent housing placements for Essentia, 160 members to area providers with 15 into permanent housing. I would like to see a higher number in the permanent housing, but I know that physical space is a limitation. And I also think that that is a reason that we find ourselves constantly working with more providers rather than being able to build the physical spaces that people need. So that's something I'm thinking about as we go through some of these proposals. On the cost, I do have a question for staff. If it would be possible to receive, and maybe we have received this before, but to be recent possibly, the last 3 years with the program cost breakdown for each organization, that would be really helpful, I think, especially in comparing the costs between these proposals and what already exists.
We can get that for you.
That would be great. Thank you.
Thank you.
That's all for me.
Vice Chair.
Yes, okay, so Essentia has done great work from what I've seen and understand, but I am very concerned. I actually was trying to connect someone in the park to the services about 5 years ago, and it was not effective. So I'm asking Essentia and everyone who's applying to us that when a commissioner or someone's trying to get service, that we make it as efficient and as effective as possible. And that's it. I would like to pick up the phone and call Essentia and say, I have someone in the park, I have someone on the street, I have someone in my parking lot. Please help me get them services without having to go through a lot of extra steps. So, but thank you all the commissioners for your comments.
Yep, thank you. I have no additional feedback on that one. Thank you for the proposal. It was easy to read. All right, next up, Awakening Recovery, Dynamic and Sustainable Substance Use Disorder Recovery Home Peer Mentoring Process. Commissioner Wyville.
Nothing to add here.
Commissioner Ayers.
This is Awakening, right?
Awakening Recovery.
Yeah. I just like that they have a $65 scholarship per person. It just, the application made clear sense to me, what they're doing and how they're doing it. So.
Commissioner Borelli?
Agreed. Like how it's been going so far. Thank you.
Yep, thank you. Commissioner Palmieri?
Excuse me, I'm so sorry, folks. I agree, and this particular place is, as I'm clearly understanding, is fee-for-service, correct? So it's very difficult for me not to support something that we're not actually laying money out for and that we're only paying as we go along. That's just a comment, it's not my decision. Thanks.
Thank you. Commissioner Steele?
Yeah, I just wanted to highlight, I also felt the application was very clear, very well laid out. I think it's a very reasonable ask. But I also really appreciate it under the priority populations, the formerly incarcerated, alternatives to incarceration, the LGBTQ community, in addition to BIPOC communities, and that staff or alumni. One of the things we've been asked repeatedly by the public and folks is we want to see folks with lived experience as service providers and as a part of these teams. And so really appreciate the way that that was all laid out. So thank you.
Great. Vice Chair?
On the whole time. Have you been listening to me breathing? Well, I see here they're going to work with LA County Supervisor Lindsay Horvath's office, so that's a good thing. She's homegrown here. I have a question for staff in regards to this. How does one get a scholarship regarding service?
That's essentially what we're doing now with the fee-for-service. Once it's confirmed that the person is a West Hollywood community member, then the agency will send us an invoice and we will, as the program administrator, I oversee the budget. So I keep tracking to make sure that we don't overspend with what we've allocated for programming, but that's what it is now.
Fantastic, thank you.
Mm-hmm.
Great. The next one we're looking at is Being Alive, People with AIDS Action Coalition, HIV Mental Health and Wellness Service Center. Commissioner Steele. Commissioner Palmieri.
Over the years, I've had the good fortune to visit the several Being Alive sites, and now I've been able to visit their drop-in site that you can get so many things there for free as far as safer sex kits, safer smoking kits, even hygiene kits. They have a proven track record for me, and I support them very much.
Thank you. Commissioner Borelli. No comment. Commissioner Ayers.
I really like Being Alive's program. I think they're ahead of the curve in a way. They're already collaborating successfully with other partners with the city. They actually have people from other organizations at their sites doing outreach. They're part harm reduction, part recovery, and just super valuable to the city.
Thank you. Commissioner Wyville.
Nothing here. Thank you.
Vice Chair?
I'm glad they're still here. I'm glad they're still taking care of our community. But other than that, I was happy with the application.
Agree. Thank you. And they've presented many times at commission meetings, and their data always proves that it's working. So grateful to see that you're returning with a proposal this year. Next up is Bet Zedek, Prevention and Ending Homelessness. I will kick it over to you, Commissioner Wyville.
I don't have much to add. Big supporter of Beth Zedek's work. I think that this will continue to be a space in West Hollywood that we need this service and this support. And I think of the organizations that we support in West Hollywood and contract with, that Beth Zedek's one of the finer ones and more successful.
Commissioner Ayers?
This is one of the more expensive applicants, but hey, we're talking about legal services and quality legal services, and frankly, they are preventing people from becoming unhoused, usually because of unscrupulous landlord practices. And once someone is unhoused, it becomes a lot more expensive to get them rehoused. So I think this is well worth the expense.
Commissioner Borelli.
Ditto, concerned about the cost, but it has turned out really well for a lot of people in our community.
Commissioner Steele.
Yeah, a big supporter. I think that this is extremely important work at this time. I think in terms of talking about staffing and how they're incorporating, I was really happy to see how much of the team identifies as BIPOC, that there is a black woman that's a directing attorney and also a Russian-speaking project attorney. I think it's really important and speaks to the city's core values and mission. So,
Commissioner Palmieri.
Just a comment. I've seen many iterations of Beth Zedek. It does look like it's a high amount when you look at it first blush, but they have continually surpassed their scope of service, and I'm a big supporter of this organization. Thanks.
Vice Chair.
Big supporter of the organization. It's a large amount of money, and I hear what all my fellow commissioners are saying. So it's that amount of money to serve 1,004 West Hollywood community members. So yeah, I'm looking forward to seeing it work.
Yeah, agree. Less than $700 per person to keep them in their homes. Doesn't feel like a massive expense when you break it down. I was curious where the 1,004 number came from, if it's just based off of past experience or some sort of algorithm. But very excited about the work being proposed here. All right, next up is block by block outreach services. Commissioner Steele.
Certainly. I have to say that I think this is a public safety initiative. I don't think that this belongs with Human Services. As a former public safety commissioner for the city, under the work of reimagining safety, working with our policing partners, and having those conversations about how we work with Block by Block, how we incorporate Block by Block. I'm a supporter of Block by Block, but that to me is a public safety initiative. I also haven't, quite frankly, seen the cultural competency for LGBTQ outreach, being out in the streets, working with Block by Block, physically going through incidents in the community with Block by Block. I haven't seen that. That's something that I think that needs to be expanded on before that's offered as a service that's provided to the community. They're already serving the community, and I haven't seen that level up for me yet. But I think this is a full tilt boogie public safety item and not a human services spend. So.
Commissioner Palmieri.
I have to agree with Commissioner Steele on that.
Commissioner Borelli.
This is a tricky one. I get where you guys are coming from for the public safety component, also a former public safety commissioner, 10 years. But it's also a different group. It's not the same ambassadors doing the outreach. That said, it's extremely expensive. It's also, I just don't know if they could ramp up that quickly and be effective. My other concern is they are already here in a public safety aspect in the city, and I just don't know if I'd put all my eggs in that one big basket with already having a public safety contract. Thank you.
Thank you. Commissioner Ayers.
I agree. This is a tricky one. I'm kind of looking favorably upon this application. I don't know if we go full bore with the whole thing at the whole amount, but I would love to see the city find a way to do a pilot program, because they are out there, they are often the first contact with a lot of the unhoused. I've spoken to some unhoused people getting other services at Plummer Park, and they trust the block by block. They don't see them as police or, so already there's a bit of trust, and already block by block has been kind of helpful to giving useful information to people who are unhoused in the city. I would like to see some kind of pilot program put together, just maybe not exactly in the iteration we've received in this application.
Commissioner Wyville, and then we'll go back to Commissioner Palmieri.
Fully agree, Commissioner Ayers. I think a pilot program would be really smart here. I do share the concern that two separate block by blocks could be confusing to some, but I think there's a way to differentiate. I think that's a hurdle that we could get over. But it is a lot, and I think a pilot program, which is, I believe, how block by block originally started through a pilot program, would also be a really great way to start on this program. And I don't know if block by block is open to that. Maybe that's a question staff can send. But that's all.
Commissioner Palmieri?
I wanted to make sure that the folks out there know that I support block by block. They are an extraordinarily responsive provider. I've called them many times I live on a block with a park, and I've called them many times for assistance for folks that are down or on the ground, as they call it, whatever. It is an enormous amount of money, but I just think somehow, some way, it just doesn't, it shouldn't come from us. Thanks.
Vice Chair?
I love block by block. I thank them every time I'm riding my bicycle, walking through the streets, walking the dog. I appreciate them being out there, being so vulnerable and protecting us and being the first step of defense. This is a lot of money. And I also, when I was reading it, I'm like, why is this not coming from public safety? I'm going to agree with my commissioners. I think a pilot would be great, and I think the budget needs to be reworked. That's a good amount of money. So those are my two cents on it.
Commissioner Steele?
Thank you. I think we're, on one hand, saying it's not the current block by block, but then we're celebrating the current block by block, which again I support and I've been a supporter of as well. So the reality is this is what $17 million of requested funding, right? We have about $8 million budget. We're talking about duplicates. We've already talked about duplicates. Getting a pilot program with block by block off the ground during public safety took quite a long time, right? And so for me, it's not necessarily just, do we need another? We have a lot of pilot programs in the city. There's a lot of programming. There's also a lot of competent service providers. If we're talking about street outreach, great on block by block. If we're talking about those level of touch points and referrals to services, I'm here for it. If we're talking about actual case management, behavioral health services, HIV and STI treatment, I don't want to replace funding for long-time, rock-solid treatment service providers that we have relationships with or other folks doing that work for a pilot program for someone who wants to lean more into that work in this city. So just wanted to clarify my
Thank you.
stance.
Yeah, I pretty much agree with the things that have been said here. I like the inclusion of technology. I'm not totally familiar with those platforms, but I think that it's always interesting to see how folks are using technology these days to address these problems. I did like that the connection to public safety, that that block by block is in this city, and that it is part of our public safety purview, but also bringing it into human services. I think there's value in that. Agree on the expense. I know that it is currently operating in Santa Monica. I would love to know some of those outcome numbers, how that's doing, and how that has had an effect in the community. Any even qualitative stories would be very helpful. But that's what I got. Great. So with that, we will go on to Coalition for Economic Survival, West Hollywood Tenant Outreach and Education Program. I think we're over to you, Commissioner Wyville.
Sure. Coalition for Economic Survival does not currently contract with the city. That's correct? Staff? Correct. Okay, that's what I thought. Yes, new application. I was just making sure there was one line that said that CES has been providing the services for 5 decades.
Excuse me,
Maybe
Commissioner
time passed.
Whiteville. I'm sorry, just wanted
Yes.
to provide a correction. So CES is not currently with the Human Services Division. I do believe that they had or currently hold a contract with our Rent Stabilization and Housing Division.
Great, thank you. That's good to know. And maybe that is a place that CES could continue their work. I just think that, as we are looking at the providers that we do contract with, I don't know, again, what unique addition is being added. Someone could tell me another answer, but that's all for me. Thank you.
Commissioner Ayers?
If we could give a minute to Eugene, I'd like Eugene to come up and explain, clarify what CES does in comparison to BetZedek.
I think we wanted to hold questions, right?
No? Oh, I'm sorry. I misspoke.
Sorry, Eugene.
My
We'll invite you
understanding
up
is
next round.
CES is more of an advocacy organization, and they do outreach to community members and organizations to let people know what their rights are as a renter. And I don't know why the Rent Stabilization Division is pawning this off on the social services. I would like to see it continue under rent stabilization because it is an advocacy and it supports that division's mission and goals. I do see the value in CES. I just don't know if it should be included under human services.
Okay, Commissioner Borelli?
Also to clarify, CES did help the city get its start and founding all those many years ago. And they have been working directly with folks ever since, whether they've had a contract with the city or not. I think sometimes, I see them a little bit differently. Sometimes we reach people where they are, and I think that they have earned the contacts and connections with the general community, especially with Russian-speaking members who oftentimes get overwhelmed by forms, overwhelmed by reaching out and getting the information themselves, and they kind of help handhold them through this. I get why this might be a rent stabilization thing, but they made an application with us. I certainly would consider it. Thank you.
Commissioner Palmieri?
Now, I fully support this provider. It's not a huge ask, so that part doesn't affect me at all. Where it belongs, it is a little bit of a question for me, but in all, I support this.
Commissioner Steele?
I also am in support of this. I think that the feedback that we got from the public spoke pretty loudly to this need. It was a repeated need, so I agree with Commissioner Borelli. I think it's earned. I think it's meeting people where they're at, and I think this is something that's been asked for repeatedly, and it's being very well provided. So I'd love to see how we can support expanding it.
Vice Chair?
No comment.
All right. I love that you do door-to-door outreach. I thought that was really special, and it just feels like community. And now it sounds like you have a very deep trust in the community. So I'm happy to hear that, and also happy to see the price tag associated with it. Next up is Coalition to Abolish Slavery and Trafficking, West Hollywood Human Trafficking Survivor Services. This is also another new one. Commissioner Steele. All right, Commissioner Palmieri. Sure can. Commissioner Borelli.
I'm just kidding. This is a tricky one for me. I think this is obviously something that we need to not only be aware of, but we need to work on and be supportive of. I'm hoping and I assume that our Sheriff's Department and maybe Block by Block has connections and referrals to services such as this. I do think that the goals are extremely ambitious, and it makes me wonder if they really know the city as much. So I would consider this, but I don't think that the goals are in alignment with what they would be able to do.
Commissioner Ayers?
This is the Coalition to Abolish Slavery and Trafficking, CAST for short.
Yes.
They've been making reports to the Women's Advisory Board for years now. They're very aware of what's going on in our city with our hotels, where a lot of sex trafficking takes place. They have a very realistic picture of what's going on. They help to pass state regulations to have places where trafficking often takes place, like hotels and strip clubs and places like that, post a sign with a hotline number. So they've been very active in the field. I think the city should do its part by accepting this application. I'm a strong supporter of it.
Thank you for that context. Commissioner Wyville?
I also am a fan of CAST, but I will say I wish there maybe was a bit more background just specifically on the numbers in West Hollywood and numbers that maybe could be achieved. There's a question that was asked on, is there any existing data on survivors of trafficking in West Hollywood? And I know this is very sensitive data and maybe it's not easy to obtain, but I do wish there may have been a better answer there. But I'm still open, and I think CAST does great work. I've worked with them in other situations before.
Thank you. Commissioner Steele?
Okay, so I hear what Commissioner Ayers is saying. I agree with that, but I think that this is, I do think this is a place where counting funding is more appropriate. I think that looking at the numbers in West Hollywood, 3.75 folks per quarter versus 125 quarterly elsewhere, seems like we are putting quite a bit of funding in. So I'd like to see more data on West Hollywood, I suppose, same question. But this does seem to me like a program that that should maybe work through county and that can work with our service providers that are currently existing, like the sheriff and other folks.
Thank you. Commissioner Palmieri?
So I support CAST. I always have. I asked for someone to come and speak at our commission, and I was told by the then director that that is doesn't happen in West Hollywood. There is no sex trafficking. So now it's come to us. I agree with Commissioner Ayers. There is value in this, but I agree with Commissioner Steele that there is not an enormous need for this for us. It doesn't seem like a huge ask for me. I don't like the answer to the question that was posed to them, but it doesn't seem like a huge ask to me if they indeed are saving some folks from this.
Thank you, Vice Chair.
I have been very familiar with CAST for many, many years now, and they do wonderful work, and I've been to a couple of their events, and it's heartbreaking to hear the information that's being shared. I think the cost is more than fair, and if we can, I'd rather err on the side of safety and save people's lives and stop people from being trafficked. I would go for this. Also, this is a business that's very secretive. It's underground. Getting the data is going to be really tough. It could be happening in the homes in West Hollywood, and we don't know it. But if we can make resources available so people can get the information to get out and get the services by CAST, I say let's go for it.
Thank you. I believe my questions for this organization were already asked, but just basically kind of like, where did we get that number, right? Where did we get to 45? And why is that the goal? And the other question that I had was, it was only 3 outreach activities per year. I feel like maybe, is that low or should there be more? I'm curious why 3? And that is all I have on this one. Next up is Defense Diagnostics, Inc., West Hollywood All-in-One Fentanyl Testing Program. I lied, I'm so sorry. We're Community Bridge Housing Corporation, WeHo Bridge to Community is next, then Defense Diagnostics. Appreciate you, Vice Chair. Commissioner Wyville.
This is also one of the pay-for-fee models, which I'm a fan of, and I think we should have a lot of really great applicants to consider, and I think this is one of them. I don't have anything else to add beyond that.
Thank you. Commissioner Ayers?
Yeah, I wasn't sure about this one because, frankly, it doesn't mention where they would house people and what resources they have access to. You know, we have Essentia, and we know they have a shelter, and we know that they have beds. And I feel like Essentia is kind of meeting that need for us. This would be adding on to it for something similar, and with too many, in my mind, unanswered questions as far as like where they plan to house people and how they plan to get this housing. So I'll leave it at that.
Commissioner Borelli?
I had the same concerns as Commissioner Ayers with the where, and I'm certainly open to fee-for-service, though.
Great. Commissioner Palmieri?
My thought is a fee-for-service. What do we have to lose? We can always reclaim the money, and we may save a few lives. I'm in support of this.
Commissioner Steele?
A little torn. I agree on the questions about the where. I think there's a lot of crossover with other service providers that we already have. So again, looking at something that's a new program, bringing a new program in, and then having to work out the kinks, it's only up to $60K, so there's a plus there. I don't know if I'm having it wrong, because I don't see it here now, and I apologize if I'm confusing, because this is a big booklet, but were there 5 dedicated beds for the $1,000 investment per month? Did anyone else read that, or is that a different proposal? And again, I apologize if I've confused that. Maybe that could be answered. That is correct. So that's 5 dedicated beds per month for West Hollywood placements. That's how I read it. Okay, so I think once we get the where, at least we know that's 5 dedicated beds, and then I think, you know, from there, there's probably some other questions, but that is a little bit more. Other than it's a provider that we can reach out to, having 5 dedicated placements is a good number, I think so.
Can't hurt. Vice Chair.
Duplication of service to be able to help people find housing and get off the street, I have no problem with that. It's a decent price. I like the fact there's a commitment of 5 beds. If there are 5 people, 5 organizations helping to feed people, 5 organizations helping to put people off the streets, take them off the streets and do wraparound services, I say duplicate away.
Thank you. No feedback from me. Next up is Defense Diagnostics, West Hollywood All-in-One Fentanyl Testing Program. Commissioner Steele, I pung over to that side.
Yes, and just so you know, Commissioner Borelli, that I had everything organized by the other order we were given, so I keep having it flip back. So I'm not a chicken. No, but I am in support of this. My understanding is that there was an activation during Pride that was very well received, that Human Services supported as well. I think it was 4,000 kits that were given out, if I'm not mistaken. 1,800. 10,000, 1,800. Yeah. Do I hear 20? Okay, so a good number. It was well received by the public, from my understanding. It was very helpful, and it seems to me they've already kind of gotten their feet wet in terms of activating with the city. There's already a relationship there, and I think it's something that, under the category of duplication, I do support doing more of. I support doing more of a lot of things. It's a tough decision, but I'm in support.
Commissioner Palmieri.
I'm fully in support of this particular provider. First look at the number, it's a little bit high, but then when I get facts that every single device was taken in Pride, it was very, very successful. And if anyone knows my history, it's helping folks get into recovery and helping folks stay alive. This is something that I'm fully in support of.
Commissioner Borelli.
No-brainer, support.
Commissioner Ayers.
I guess I'm going to be the opposing voice. This is about distributing a bunch of devices that specifically test for fentanyl. When we have other, I guess, more manual tests, these devices are kind of new on the market. There's different ones out there that test for different things. I think the city should take a pause and see what else is out there before jumping in with this one provider.
Commissioner Wyville?
I share Commissioner Ayers' concerns, but also I really think this program is fabulous. The error rates are lower because it's a basically one and done device. And I also like that part of this proposal is the distribution and delivery services that could be offered. I think that could be really helpful, especially as we're thinking about shame and stigma and ensuring that we are reducing harm. But they are also more expensive, and there are other tests. So I hear both sides of the argument here, but it does seem like a really promising technology, and I do think it's something we should consider.
Commissioner Palmieri, you had something else?
I just want to add, the fentanyl testing strips that we currently use, very good. They've saved a lot of lives. Certainly they have. This particular device tests for several different types of fentanyl. It's more sensitive. It has the capability of saving more lives. It sounds duplicitous, but it's a little bit different here. I support it fully because of that. There's so many types of fentanyls out right now, or however they're fixing it or mixing it or whatever they're doing, and this has the capability of, it's so sensitive, it has the capability of identifying that. To me, that's hugely important, but I understand your side, I truly do.
Vice Chair.
Well, I feel super old because I didn't have to worry about this in my party days. Yeah. Jeez. I'm totally behind this. I love the fact that they're going to look into doing a harm reduction vending machine. I think we have to be modern in our approach to things. Anything to keep men and women safe in the city of West Hollywood. Fentanyl is a huge issue, especially for a lot of straight women who come here to party and think they're going to be safe. It's and gay men, everyone who comes here, you think you're going to be safe because you're in a gay bar and there's great music and friendly people, but there's predators everywhere. So I'm behind this. I appreciate all the devices that were given out during Pride. This does test for more, and from what I read, it's very effective. But it is, staff, it is one and done, or can it be used as one and done? Okay. But I'm behind this, and I would love for the city to make partying safer for individuals here who live here, work here, and play here.
Commissioner Wyville, you had something?
Just one more thing as we're on. I think this is the first harm reduction proposal that we're looking at. One thing that I just want everyone to keep in mind that this commission has talked about over the last year or so is the locations of where these are distributed, making sure that they're not just in Boys Town, throughout the city.
Thank you for that. I went down the rabbit hole on this one, as I also thought it was fantastic. I have a couple of questions. I don't know if they're here tonight and can answer when we go into that portion of this evening. But one was, I saw some reviews on Amazon that the product didn't work. Will that be replaced if that happens for a community member, if the product doesn't work, free of charge to the city? That was one question that I had. And then another question, and this is probably for staff, and I'm sorry, I don't know this, but there was a lot of mention of vending machines and putting them in there. Do we have harm reduction vending machines? That's a nice idea.
There's one at the LGBT Center in Hollywood.
Oh, nice.
Yeah.
I like that. And then just a comment, because I, again, did some math. In 2024, the city of West Hollywood had 135 overdoses of fentanyl and 25 fatalities related to fentanyl. So if you do the math, this is $650 roughly to save a life, and that feels like money well spent, if you ask me. All right. Oh, yes, Commissioner Steele.
Yeah, I just wanted to echo that. I think when we get into the numbers, and we all want to save lives, but those are real West Hollywood numbers. Those are real lives that could have been saved, and that is worth every penny. In addition, as we're talking about pilot programs, we have the luxury of just having one hot off the presses. It just ran, it worked incredibly, and the public reacted very strongly to it. So those are great results, and I think we should factor those in.
Great. All right, thank you, everyone. Next up is Disability Community Resource Center, Independent Living Services for People with Disabilities. Where did I start last? I think we're over to Commissioner Wyville this time.
I love DCRC. They do good stuff for West Hollywood.
Commissioner Ayers?
Yeah, they definitely transform the lives of people living with disabilities. Big yes.
Commissioner Borelli?
Ditto.
Commissioner Palmieri?
I have nothing on this.
And Commissioner Steele?
I agree with Commissioners Borelli and Ayers.
And Vice Chair?
No comments.
I didn't even have time to read through my own notes, but that, I agree. Looks great. All right, next up, Episcopal Diocese of Los Angeles. This is our friend Seeds of Hope. I believe we're starting over here with you, Commissioner Steele.
I don't have any feedback on this item.
Commissioner Palmieri?
Where am I? Oh, the book. Okay, okay. You know, I originally didn't support Seeds of Hope at all when they came around one time, and I think they got a little bit mad at me, but I didn't think that this was the area that they would be successful. Clearly, I was wrong, and I always admit when I'm wrong. And I think that this is a good service. The numbers are good. It's a lot of money, but I think that they provide a lot of service. So I support this.
Commissioner Borelli?
This is the one I have to abstain on.
Commissioner Ayers?
I'm a big supporter. I've seen them in action in Plummer Park. People in the line are chatting with each other. They're chatting with the people distributing the food. It's a community engagement thing. I was surprised to hear that the city doesn't fund them already. So this is just a no-brainer. They've already done the work, and they need to have a real contract.
Commissioner Borelli?
They're in the wrong place because the city does fund them already.
Yeah, they can't. They're in the new section. Right?
They're in the new section, but they're just trying to expand their current proposal.
Oh, okay. Commissioner Wyville?
All I have to add is that I think all of the food programs that we have supported and all of our new applicants should be very seriously considered, especially in light of some pretty rough federal cuts that we just had.
There we go. My light's a little. Commissioner Steele, you had something else?
Yeah, I just wanted to get some clarification from staff on previous and current funding for Seeds of Hope. Do we have that?
Vice Chair?
No comment.
I just want to call out that as a returned Peace Corps volunteer, I was very upset to see that they lost their AmeriCorps volunteers, and I thought that it's amazing that Seeds of Hope used AmeriCorps volunteers to drive a lot of its programming, and that is a massive loss. So I am in strong favor of supporting them and helping them fill that gap.
And just to answer the question, for Seeds of Hope, their current contract is $78,954.
Okay, that's what I was thinking. Thank you. So that was the main question, but I'm in support of this proposal.
Great. Next up is Healthcare in Action, Comprehensive Homelessness Solutions in West Hollywood. I will go over to you, Commissioner Wyville.
I don't have anything on this one.
Commissioner Ayers?
This is a strong yes for me.
Commissioner Borelli?
Sciatic, I have to stand sometimes. I've had concerns about Healthcare in Action. I think they started out slow in the last contract, then things caught up, and in the last few reports we had some challenges. So I have some concerns about their being able to deliver. Relatedly, as we've said in the past, there's a lot of duplicative proposals in front of us. We have the Met team as well. I'm not a fan of expanding to 24/7 street medicine. If they were willing to continue on in the hours that they provide now, then I would consider it. Thank you.
Commissioner Palmieri?
I'm very much in support of them. I've seen them in action. As I said before, I live on a street with a park, and as you would assume, a lot of unhoused folks stay in the park, and I've seen them do amazing things. So I'm in support of this.
Commissioner Steele?
I'm also in support. I think it's a reasonable increase in funding. So,
Vice Chair, we're at Healthcare in Action.
No comment?
All right. I think that they also do incredible work. It's a lot of money. It's a big chunk of our budget. So I think it's something to think about as we look at all the various services or proposals that are offering similar services. But I do know that the impact that Healthcare in Action has had in our community has been significant. Great. Housing Works, Home First. Commissioner Steele, are you ready? Got nothing? Commissioner Palmieri?
I support them.
Commissioner Borelli?
Legacy provider, good price, support.
Commissioner Ayers?
Same.
And Commissioner Wyville?
Nothing from me.
Vice Chair?
I love the budget. I love the numbers.
Excellent. All right, I have nothing to add on that one as well. Next up, we'll go into Jacob Joseph and Jabez Family Counseling Professional Services Group, Inc. Commissioner Wyville.
I don't have much to add to this one.
Commissioner Ayers.
This is a service that's kind of it would be a new provider in an already, we already have some established providers. I'm thinking of Maple, but I'm also thinking of Being Alive, which actually does a lot of therapeutic help. So, and the LGBT Center as well. So, I'm inclined not to add another service in this area.
Great. Commissioner Borelli?
I'm pretty much of the same mind.
Commissioner, you already went, right? No, I'm losing track of my everything.
I'm also in line. I'll say that I don't think the application did anything to convince me otherwise, but it's a massive amount of funding in a crowded landscape already. We need the resources, but we've got some great partners, so.
Commissioner Palmieri?
I was going to take a pass on this, just not to sound like I didn't want a group to come in, but this is a lot of money. It's a new group, and we have these services. Had they, like Commissioner Steele said, had they proven that they were going to do something different or something that we didn't have, or they were filling up a barrier or a space, I'd think about supporting them, but I just don't support this.
Vice Chair?
Well, I appreciate the public comment that was made. This is a new program, and I don't want to sound like I'm contradicting myself. I do like to duplicate, but I don't want to duplicate at this amount of money. This is a good amount of money, and it was a very lengthy application, and nothing really punched me in the nose like we have to do this.
Thank you. I agree with my colleagues up here. I did appreciate, I think this was one of the only mental health ones that talked about ACEs, which I think is very important, but I do agree we have a lot of exceptional existing mental health organizations working in the community and a lot of other great proposals to review. So I think my reaction is the same. Next up is Jewish Family Service, Los Angeles, West Hollywood Comprehensive Service Center. Commissioner Steele.
I am in support. I was going through the community evaluations and feedback, that this was one of the groups that just comes up again and again and again as a constant resource and a constant organization that follows through for the community. So,
Commissioner Palmieri.
I'm fully in support of this.
Commissioner Borelli.
I just want to say publicly, my first time, I think it was 2016, I was sort of knocked out by the cost, and then I got to see what they did and how many people they served. They hit their numbers, and it's just such a breadth of services to our greater community. I visit Plummer Park often and see what's happening there, so I'm in full support.
Commissioner Ayers.
Yeah, they've become a really important hub in Plummer Park for a variety of services.
Commissioner Wyville.
Nothing but good things to say.
Vice Chair.
No comment.
All right, same here. They've been doing amazing work. Jewish Family Service Los Angeles Senior Nutrition Program. Commissioner Wyville.
I think I'm coming back to the point that I made about Seeds of Hope. I am very concerned about, I think, nutrition for lower income and older adults. With benefit cuts, I think we have to keep supporting these programs. And people, people love this one.
Commissioner Ayers.
This is a beautiful program. It is. I mean, if you stop by and see it in action, I mean, not only do they deliver the food, but they have, open seating in Plummer Park, and people get together, and so it's, people engage with one another. They get out of isolation. So it goes beyond just nutrition and food sensitivity. So it's very important.
Commissioner Borelli.
Yes, but here's my concern. This is not directed necessarily at Jewish Family Services Senior Nutrition Program or even SOVA Food Pantry. I'm concerned about hoarding. I'm concerned that we have potential duplications in what we're already providing. I've seen it with a neighbor of mine who gets extra meals from his neighbor, and it gets passed on. I also work in affordable housing, and I see how oftentimes older adults or people who are food insecure tend to take a lot, and maybe as we talked about at our last meeting, there are 33 people on a waiting list for food, and it concerns me if it's all here. So I'm not sure how to do that. I'm absolutely supportive of this program. It's a lot of money, and I hope that we're not duplicating. Our unduplications are true unduplicates.
Commissioner Palmieri.
I'm fully in support of this. I'm Italian, so of course I support all food items. I actually know folks that have used this service, and yes, there is a waiting list, and I wish there wasn't. But a lot of people tend to believe that everyone in West Hollywood is wealthy, and we all know that that's not true. There are a lot of folks here with food insecurities, and so I support this fully.
Commissioner Steele.
I'm going to be up all night trying to figure out how to unduplicate our unduplicates. So I am also in support. I think that food insecurity has come up again and again and again, and I appreciate what Commissioner Ayers also said about the connectivity that's come up a few times and offering that space for people to get folks out of isolation, to connect with others. We know those examples are going to happen as well, but I think hearing from our Disabilities Advisory Board, hearing from our older adult advisory board as well, that they're looking for connection, they're looking for a space, they're looking for food, and they're looking to feel welcome and comfortable in receiving those services. So for me, I'm all in.
64,470 meals, that's all I gotta say. Vice Chair?
Ditto.
Awesome. Jewish Family Service Los Angeles SOVA Community Food and Resource Program. Commissioner Steele.
I'm not going to look at Commissioner Borelli. I'm just going to say support.
Commissioner Palmieri.
Full support. I've seen them in action.
Commissioner Borelli. Commissioner Ayers.
Strong support. This is another place where unhoused people can not only pick up food that they are ready to eat, they don't need food prep or stove or anything, but they get connected to other services like healthcare and action, so super important.
Commissioner Wyville.
Ditto.
Vice Chair.
Well, I especially love hearing that you don't need a mechanism to cook the food, because I'm running into that wall with some other organizations. We need to feed everyone, and if it's in your mission,
if it's not in your mission, put it in your mission, because if you're asking for money from this city, we want you to take care of everybody. And I love the fact that they prepare meals where you don't have to have a stove, a microwave, or open range.
I should clarify, because they have two parts to this program. One is an actual food pantry that you can go and get produce from. But they also have the thing every Tuesday morning in Plummer Park where unhoused people can get ready to eat. A lot of the things are like from, our supermarkets, and they collect it and bring it to them, and it's good food.
Yeah, I totally comprehend that, but I'm still going to stay with what I just shared. But thank you for expounding on that. Yeah, thank you.
Commissioner Palmieri?
I want to make sure that folks know that they don't just provide produce. They provide a lot of canned stuff. They provide a lot of dry goods. They provide hygiene items. This is an organization that really tries to help. And so I just have to say I'm in support of it. We're talking about the pantry part. Thanks.
Great. Thank you. I have nothing else to add other than we need to go find $10 million more. Okay. Jewish Free Loan Association, West Hollywood Loan Program. Commissioner Wyville.
I want to like this one, but I can't. They have addressed this head on multiple times that this is not predatory, but I have a really hard time getting over that myself mentally, because I think that some of the other programs that we support, are offering grants that are not needing to be paid back. But I also understand that an interest-free loan could really help some people who are on a bit more stable footing. But I'm having a hard time making up my mind on this one.
Commissioner Ayers.
And I wish I had a conclusion.
I think I feel the same way as you do, in that I really like the idea of this, and I think it could operate like NCJW's tenant, what is it called? The rental assistance program, where the city actually funds the money and they operate it, they facilitate it. But I'd want to know what else is out there like this, and do some comparison shopping before committing to something, just one provider at first glance. So I'd say not at this time.
Commissioner Borelli?
A huge fan of JFLA. I know people who have benefited from this, paying as little as $12 a month to pay back. I did ask the question in the question and answer period about would somebody still be eligible, and they would. So unfortunately, because of our budget, I wouldn't be able to recommend moving forward.
Commissioner Palmieri?
They've worked with us before, and I don't know if any of my colleagues remember, and it didn't work. Not that it didn't work because it's not a good provider. It is a good provider. It's an expensive one, and there's barriers, and I don't like barriers. The barriers with this are several. If you have bad credit, and many people that need money have bad credit, that's going to be a barrier. You have to have a cosigner. Maybe no one has a cosigner, and it has to be paid back. Now, I understand that the payments are very small, interest-free, and I really, really do like that. But it's a barrier that probably would exclude some of our folks. So I just can't support this as it is, but I do know they provide a good service.
Commissioner Steele?
I agree with Commissioner Palmieri. I think the credit score is a big one for me. Folks that are in this position often have that's a high barrier for me. So,
Vice Chair.
Yes, we did use this when I first became a commissioner 103 years ago, and there were hiccups back then. But I would love to see them work out the bugs, and then, people in West Hollywood need help. So as of right now, I'm just going to keep my mind open about bringing them on board.
It's my understanding that they focus on the unbankable, so you do not have to have credit or good credit to get a loan. Yeah, if we can get clarity on that, that would be great, because that was what got me interested, especially in a time right now when we have a lot of immigrants coming from different parts of the world. It's very hard to get any kind of loan if you don't have a credit score, or if you don't have any of those basics that a lot of us can start up with. So I really like it. I like these kinds of programs. I think it helps people get on their feet with dignity. I think it is great for people who are unbankable or don't have great credit, as long as that is the case. I would be interested in continuing to look at this, but maybe at a smaller level, to see what we could do and see how many people actually take advantage of something like this. But I appreciate that financial literacy is included in part of the program, so that these people figure out how to turn that loan into more money and hopefully create greater wealth over time. Okay, nothing else, then we will go on to the next. JVS SoCal WeHo Works. I forgot where I left off. Commissioner Steele, is this you?
I knew you were coming. I don't have any feedback right now.
All right, Commissioner Palmieri.
I don't have anything on this.
Commissioner Borelli.
Support.
Commissioner Ayers.
Yeah, we need to keep them. They provide an important service.
Commissioner Wyville.
Nothing to add.
Vice Chair.
Nothing to add.
Agree. All right. Next up, Laurel CICT Magnet, Sensory Development and Executive Function Project. Commissioner Wyville. This is the SEL.
Yeah, it has a very low dollar amount. I find, since our meeting a few months ago, when we had parents come in wanting more pre-K childcare, I definitely started thinking more critically about what programs this commission offers to children, and I think this is interesting. I'm not sold on it. I don't think it is maybe filling the gap that does exist, which is childcare exclusively. So I don't have very strong feelings, but the dollar amount is appealing.
Commissioner Ayers.
Yeah, I'd be inclined to not bring them into the mix right now, just because I think we need to meet the demand from parents to expand the pre-K program.
Commissioner Borelli.
Unfortunately, I would have to agree with that.
Commissioner Palmieri.
I have nothing on this.
Commissioner Steele.
I agree with the earlier comments.
Vice Chair.
Nothing to add.
All right. I will just I agree with Commissioner Wyville on the amount being asked. I always appreciate if there's a new organization looking for just kind of a toe dip. What can we do together? So that's my only feedback on that. It's interesting and worth exploring, and it is that's the second youth-facing proposal, as far as from what I can tell, that's in here. So, all right. Los Angeles Centers for Alcohol and Drug Abuse, WeHo Substance Use Disorder Services. Commissioner Steele.
She loves me. I would love to know if any of our other commissioners and some of the other work that they do have engaged with the organization and have any experiences to share outside of what I have here.
All right, Commissioner Palmieri.
I would.
Commissioner Borelli.
Of concern of duplication with things we already have in place, so I'm not sure I would support this.
Commissioner Ayers.
Ditto.
Commissioner Wyville.
Agree, and I'm also concerned about their location being primarily in downtown.
Vice Chair.
I've worked with them I've worked with them before. They do really great work. I love the fact that they include American Sign Language and Chinese as their bilingual languages. not asking for a lot, but I need to think about this more.
I agree with Vice Chair. And a lot of interesting things here in this proposal, and would like to give this some additional thought. Perhaps another read? Yeah, and I think with that,
Yes.
our brains are melting.
Yes. Would the commission like to take a 5 or 10 minute break? A quick pause? 10 minutes? 5?
Aye.
Yes?
I motion that.
10? 10 minutes?
10 minutes.
Okay, let's take a 10-minute break and we will go ahead and come back.
Thank you. Welcome back, everybody. Hope everyone hit the coffee bar. And there isn't one, but would have been nice. Really? All right, welcome back, everyone. Thank you for that break. I feel refreshed. I think the rest of the commission does as well. Hopefully you all were able to stretch your legs. We had one question for staff coming back into this, which was the next organization is LA LGBT Center. Since there are so many, can we table those to the end? Is that something we can do, or should we just keep moving through? Yeah, all right. So then I guess it's up to us.
It's your show.
Yes.
Do you have to take a formal vote, or can we
Do
just?
you need a motion?
How about a thumbs up?
Thumbs up. All right. Commissioner, are you comfortable moving this to the end? Okay, fantastic. So then with that, we will go into Los Angeles Section National Council of Jewish Women, Thriving in Place. I have no idea how I ordered it last time. So Commissioner Steele, you feel ready?
You all can't see me telling her, don't come to me. I will hold for right now.
Chair?
Yes.
Did you say National Council of Jewish Women?
Yes.
Should we do Men's Health Foundation before that?
We're going in the alphabetical order of the booklet.
The order is different in the book. Yeah. Yes, thank you. Thank you, and apologies.
If you are ready. It's initiation.
It's true.
It is initiation, and just so the public knows, we have 3 different formats for how this is laid out, so we're juggling a little bit to try to see, just in case you're wondering why we're not super clear on where we are. I have no feedback on this one right now.
Fantastic.
Thank
Commissioner Palmieri.
They have a proven track record. I'm almost supporting this, not completely. It's a lot of money, but and I believe another provider also does rental assistance and aging in place, but they do have a good reputation, and they have proven themselves many times.
Commissioner Valeri.
That's me. Yeah. Checking. Agreeing with Commissioner Palmieri, I do have a little concern about the cost. Again, we're trying to get into an $8 million window, and this is almost $500,000. However, again, proven track record. My gosh, how did we survive COVID and people stay housed without these programs, the 3 programs, one of which being National Council of Jewish Women, Thriving Place. My one maybe ask for them would be, would they consider cutting down from a 4-month opportunity to up to 3-month opportunity to save a little bit of money? 3 months to me is quite a gift. Thank you.
Thank you, Commissioner Borelli. I benefited you again. Combining names over here. All right, Commissioner Ayers.
I'm a strong supporter of this, and I'd be concerned about reducing the amount of money, just because in our last report we received from them, the demand exceeded the funds available. They had to close the portal, and it makes me wonder what happens to those people when they get a closed portal. Do those requests eventually make their way to city staff, or are they just left out in the cold without a way to pay the rent?
But is that because other people were getting 2nd month and 3rd month and 4th month? So somebody didn't get 1st month
I
and
couldn't
2nd
tell
month?
you. All it said was in that 2nd quarter, they had to close the portal.
Yeah. I want to make sure there's money going around for everybody.
Commissioner Wyville?
Extremely valid concerns, but any direct cash assistance program I'm a very big fan of.
Vice Chair?
Love the organization. I think when people apply for grants and RFPs, sometimes they shoot for the moon. I think this is a good idea. I'd like to see some work done on it, and that's it.
Question, staff, did I read correctly? Was this the organization that supported the guaranteed income pilot that we ran? That was exceptional, if I remember, and the outcomes were really great for the folks that participated. So I am in support of that aspect of this proposal and seeing that continue in some way. That was exciting to me. Great.
Chair.
Anything else? Yeah.
Sorry, could you restate the name of that pilot program, please?
What was the name of the pilot program?
Was it called Breathe?
It was a guaranteed income.
Oh, right. Oh, yes. Okay.
I wasn't sure if there was some specific title for it.
Yeah. And we did get great feedback on that from the community. So I was also going to ask staff about, in terms of the next steps, we have to divvy some of this up, looking at the funding, then to hear from Commissioner Ayers, a gap in funding caused a pause in service. I think, but it also raises a flag for me. I'd like to get some clarity from the organization on the pause in service, why and what happens there. I don't think we should be the only form of funding. I think that's a slippery slope, and I think when that happens, the pause in service, that falls on the organization. We want to support as much as we can, but I also hate to give this level of funding only to find out that our community reached out and couldn't receive services that we paid high price tags for. So I want to be overly critical. I just want to get some more information and understand what was that. Thank you, Nate.
So there are other options that are available through NCJW. You do have to be like the woman head of house and have dependents. But I can note that question to have Marjorie come up. And then from the city side, as the program administrator, it was brought to my attention. And on the back end, we are working at collecting the returned funds so that we could reallocate it to the contract so that some of the folks that have been waiting, they can receive the rental assistance that they need.
Do we have information on how long folks have been, like what the gap is and how long folks have been waiting as a result?
I want to say maybe it was like April, May when they closed the portal.
Thank you.
Great, thank you. If no further questions on that one, we will move into MBI Health Services, West Hollywood linkage to care. Commissioner Wyville. This is a new one in case you're looking in the...
Yes, thank you. I don't think I had anything on this one. No, I have nothing on this one. Thank you.
Commissioner Ayers.
This seems like it would be a duplication of services that our partners already provide at a very high price. So I'd be inclined not to pursue that.
Commissioner Borelli.
I'm pretty much in the same place. Ambitious goals, extremely ambitious goals, and high cost, and also using a third party would, and duplication. So I don't think I would move forward.
Commissioner Palmieri.
I don't have anything on this.
Commissioner Steele.
Yeah, I'm aligned. I think it's a very big ask, so I agree a little bit with Commissioner Amory's shoot for the moon statement. But I think I love that there's a black-led program here. I think that's important, but when it gets into the actual kind of crux of care for the community and some of those asks, I just didn't see enough kind of laid out here to justify the ask. So.
Vice Chair.
Well, like I said earlier, sometimes when you apply for grants and funding, some people who coach grants say ask for everything. I don't think this is the case right here. This is a lot of money. It's a lot of money, and we already have services that kind of mirror this. I appreciate the application. I appreciate what they're trying to do, but I don't think it's a good spend right now.
Thank you. I thought it was a very excellent application proposal. It was easy to read, easy to follow. I had the same questions, this versus some of the other things that we already have working in this city. But appreciate the submission. And we'll move on to Men's Health Foundation, PrEP Pet Benefits Navigation. Commissioner Steele.
Ready to rock. I am in support of this. And sometimes when people apply, they don't put commas, so I think it's $1 million ask, and I'm scared. But I'm okay with the amount and fully in support.
Commissioner Palmieri.
I'm fully in support of this.
Commissioner Borelli.
Ditto.
Commissioner Ayers.
Ditto.
Commissioner Wyville.
great cost for the amount of people served, and I was also very impressed with the response to the question about the new biannual PrEP injection. And I think Men's Health Foundation has always done a really good job of adapting to new technologies, new innovations. So absolutely yes.
Vice Chair?
I appreciate a comma too, because Commissioner Steele, I actually have it here, comma, because I was like, oh, what's that? Yes, great organization, not much more to say.
Agree. All right, NAMI, West Side LA, Mental Health Services for West Hollywood Community. Commissioner Wyville. This is in the new section.
Yes, nothing to add from me here.
Commissioner Ayers?
I see it as a duplication of existing services at a high cost, so I'm inclined not to pursue this one.
Commissioner Borelli?
I'd be willing to give this a try.
Commissioner Palmieri?
Can you guys hear me? Okay. I'm not against this, and it could close a gap that the LA LGBT Center's mental health services that we're not providing or funding. It duplicates some things, but I wouldn't be afraid to try them out.
Commissioner Steele?
Agreed with Commissioners Borelli and Palmieri, not opposed to trying it out. And I also want to say that, presenting this as an opportunity to pull us in, you can see how much folks give pause to engaging with those kind of activities. And I think it was a great demonstration and a way to kind of showcase what you do a little bit there. So I appreciated that and open to supporting.
Vice Chair?
I was fascinated by this because funding is being requested to continue a city-funded program, expand a city-funded program, expand a non-city funded program, and start a new program. So which is it? Do you guys know? It's a new program, okay. The prices, not that bad. And again, if it covers gaps that other organizations are not covering, mental health is a huge issue. But right now, I'm looking at it, it looks good. Let's see what happens.
I am familiar with NAMI and the work that they do, and I think the peer-led group is a great way of bringing people together to support one another's mental health. I really like this program. I think it would be worth a try. My only question is could, maybe also in the future, if it works, could it be expanded to have other types of groups that could get together for this, so that it's opens it up, whether it's a women's mental health program or something else, because there is some duplication with some of the other organizations that already have very strong mental health organizations for members of our community. So that was my only thought on this, but big fan of NAMI. All right, Pathways LA, West Hollywood Preschool. Commissioner Wyville.
Why not? Love Pathways. The community loves Pathways. I wish that they could expand easier. It seems to be a space limitation based off of the response that we received. I don't remember having a conversation with staff about expansion, but if there's anything that staff can add in the after meeting questions, that would be great. But big fan of Pathways.
Commissioner Ayers?
Yeah, the growing demand for this, we need to do this.
Commissioner Borelli?
Highly recommend.
Commissioner Palmieri?
Full support of this.
Commissioner Steele?
Full support. This is something we've been asked for by the community repeatedly, so full support.
Vice Chair?
Well, I have to say yes, just because of the emotional public comment that was made here last time. They're a great organization. They're very friendly, they're very lovely. Being a gay woman who moved here when there were no children here, and all of a sudden now there's like a need for schools for the children, we're evolving, so let's do it.
Yeah, one thing that I heard when in the public hearing and from members in my community is that there's a great need for childcare and pre-K for a lot of the families here. So I'm in full support of it as well. Planned Parenthood Los Angeles Reproductive and Sexual Health Services for West Hollywood residents. Commissioner Steele.
Couldn't support it more. Hard yes.
Commissioner Palmieri.
Huge a huge yes, and considering what happened to them this week.
Yeah. Commissioner Borelli.
Absolutely.
Commissioner Ayers.
Yeah, strong yes.
Commissioner Wyville.
Ditto.
Vice Chair.
Well, love this organization, but I'm very concerned about services that are aimed just for women.
It's not, though. They have.
Excuse me, I'm not done speaking.
Okay,
Thank
sorry.
you so much. Appreciate it. What number do we have of females that live in the city of West Hollywood? If we can find that at some point, okay? It's not a rush for tonight. They're going to serve people of color and women, and because I can read right here what they're doing, Commissioner. So thank you so much. But I just want to stay outside my own head because I had a conversation with a fellow colleague this evening, and I just want to put it out there that we need to focus on women also. But other than that, I think it's a great organization and they do good work.
Yeah, huge fan of Planned Parenthood. I think the only thing that sort of what I was reading it is would this grant also include reproductive health care services in addition to the STI, HIV testing, which of course is incredibly important. It says so in the title. I just want to be certain of that. But amazing organization, and they need to be protected. All right. Postal Petals, Community Floral Wellness. Commissioner Wyville, this is in the new.
Indeed. I love this idea. I think it's fabulous. I don't know that this is, given the need in the community, I don't know that this program is something that the commission can afford.
Commissioner Ayers?
Yeah, I feel the same way. As a social service, I'm hesitant to include this in the plethora of mental health resources that the city offers. I would love to see something like this offered, by in the rec reader, you can sign up for this, and it seems like that sort of thing. So, a much smaller scale than what this application represents.
Commissioner Borelli?
Social isolation is absolutely one of our priorities, and this is the type of thing that does bring people out. I've seen it work at WHHE buildings. Captive audience really helps. That said, I think their goals and numbers are ambitious, and I think that I don't think it was well fleshed out where these would take place. So I'm delighted to hear Commissioner Ayers suggest that maybe they work with the rec department to create a program here. But I don't think I would be able to support funding it from our budget.
Commissioner Palmieri?
I fully support art as therapy, and of course this is a type of art. It's a large ask, and I made notes that said this should be a city program and it shouldn't come out of our budget. And I think it would be helpful, but I can't fathom giving them $200,000 out of ours.
Commissioner Steele?
I'm aligned with the earlier statements. I don't want to detract at all from the importance of this type of a program. I also support the effort against isolation and just what this type of wellness offers folks. But I do think there's another space for it to live. I think the city's got plenty of offerings for all of our climate action efforts, our rec department. So there might be just a better place for this to live outside of this budget.
Vice Chair?
I agree with Commissioner Borelli. I mean, social isolation is a huge issue within the city and also within the city of Los Angeles and the county of Los Angeles. I like what they want to do. It's a large ask. I would be delighted to live in another part of the city where they have the money to do that. I would like to see them thrive, but it's a good amount of money. It's an important cause, so I'm just going to leave it there.
I agree with everyone. I think these are incredibly challenging times, and there's so many things to put our budget toward right now. But I love this concept, and if it's not in the rec reader, is it something where we go to our local businesses and they can sponsor a floral design workshop for one of our partners? I mean, how do we work with them in some way, shape, or form? Because I find this to be an incredible program, just not, unfortunately, for the big decisions we have to make right now. Okay, thank you. Project Angel Food, medically tailored meals and nutrition services. Commissioner Steele.
Yep, longtime partner. I think they do a great job for what they do. I think the ask is reasonable for the amount of meals provided and the medically tailored meals, so I'm in support.
Commissioner Palmieri.
They have a proven track record. They've gone over their scope of service many times. They added on, from what I understand, they added on some other illnesses that can be served from theirs. I fully support it.
Commissioner Borelli.
Agree.
Commissioner Ayers. Ditto. Commissioner Wyville.
Agree.
Vice Chair.
Well, Project Angel Food. They started during a pandemic, and they survived the second pandemic, and they do adapt, and they do care, and I have firsthand witness of it. I am very happy that they're looking to adapt to feed more people and to improve their numbers. I love the positivity of wanting to do that, and they have been here from the beginning. They started in the city of West Hollywood, and during COVID, they started feeding our senior citizens when other organizations couldn't do it. So I applaud that. I would like an exact number of how many meals they provide each week, if we can get that, because my numbers may be off, but if we can get like the number of meals they provide each week to the clients, I would really appreciate that. And I'm all about them, so. And it's a decent ask. It's a fair amount to ask for. Thank you.
Commissioner Palmieri, I had a question.
Folks, this is not me. It's the microphone. It's just not clicking on. This is for staff. Did the city just recently pay for something, a kitchen or a stove or something? Who does this?
Council, I'm sorry. Oh, I didn't realize you.
Who watches Angel Food? So did the city give some type of kitchen or stove or something recently? Because they were going to expand?
They did. That did not come out of our
No,
line
I
item.
understand.
Yeah.
I understand. I just want to make sure that I know that they will expand and it's not just on paper.
I wrote give them more, so that was my feedback. Rainbow Hill Enterprises LLC, Rainbow Hill Recovery. Commissioner Wyville.
I love Rainbow Hill. I had the opportunity to meet with Rainbow Hill a couple months ago and really fell in love with their programs. I think that the RFP maybe didn't give the best image of the work that they do to all of the commissioners, but I am a big fan of their work and their tailored sort of intensive therapeutic approach, especially for LGBTQ clients. I think we have a lot of, maybe it's my perception, but the way that I've perceived a lot of the existing contracts we have that deal with mental health are often geared towards not an older population, but not a young population. And I think Rainbow Hill is very much geared towards a youth population. Maybe that need is there in the city right now, maybe it's not, but I was really impressed, and I don't know what will happen with their application, but I definitely want them to stay in this conversation.
Commissioner Ayers?
No comment.
Commissioner Borelli?
Sorry, we're talking about Rainbow Hill,
Rainbow Hill.
not Rainbow Labs.
Correct.
Okay,
Correct.
Just checking. My question would be, is it possible for them to go to a fee for service? I want to know if it's possible for them to go to a fee for service. We can add that to our questions. Thank you.
Commissioner Palmieri?
When I see the community not using, then I may not support recovery services so well or so much, but I see my brothers and sisters still using after all these years, people dying, and to me, this is a small ask for a big service.
Commissioner Steele.
I'm aligned with Commissioner Palmieri. I think it's a really important service. I also support Commissioner Wyville's comments as well. I think demographically, it's a demographic that needs service and service in a different way. So I appreciate it.
Vice
But I
Chair.
agree on the proposal, by the way. I agree on the proposal as well.
Vice Chair.
I agree. Commissioner Wyville, I'm with you. I mean, it's my job as an elder to put you on my shoulders, and with the mental health issue, it is the job of our community to put our youth on our shoulders and to give them a healthy start and to teach people that therapy and self-care is important. I would like to see the conversation continue, and I like the suggestions that my fellow commissioners made. That's all.
I agree. I agree with Commissioner Borelli's question on could this be fee for service. I think that the numbers were ambitious, and I love to see that. Curious to see how we landed on those numbers and what versus what we think might be realistic. And I think a fee for service is probably a good approach for this organization for now until we sort of see how it works. But I'm really impressed by the work and anything that helps people get into recovery and stay in recovery is something I support. Next up, Rainbow Labs, LGBTQ plus youth after school and seasonal programming. Commissioner Steele.
Yes, I am very excited about this one. I'm in full support. I actually work to develop some programming like this on the East Coast. And I think, Yola spoke very beautifully earlier about what we're facing right now, what's being, taken. And I think getting our kids trained and having STEM programs available is massively important considering this administration and the challenges ahead. So I don't think we can educate our kids enough, and I'm in full support.
Commissioner Palmieri.
I'm in full support of this as LGBTQ is being erased in schools and books are being taken away, and there are no mentors at younger ages, and there are no people to look up to. They don't know where they're going. I think this would be a wonderful addition to our programs.
Commissioner Borelli.
I'm not sure about this one.
Commissioner Ayers.
No comment.
Commissioner Wyville.
I'm obsessed with Rainbow Labs. I think they're fantastic. They are incredibly well run, a very well run organization. They do amazing work. And I think we've seen a need for more youth targeted services, and this is exactly what this is. I think the cost is okay. Maybe it's a bit, maybe the targets are a bit optimistic, but I think this is definitely one we should consider.
Vice Chair.
I'm always thank you to my fellow commissioners for swaying me to be all about this now. And I think what Commissioner Palmieri said is essentially important. The erasure of LGBTQ community right now is terrifying. So anything we can do to keep our hope alive and our history living, let's do it.
I was also excited that this was for teens. We have 3 youth-facing organizations that submitted proposals, and it's pre-K, K through 8, and high school. So it feels a little no-brainery to me. I agree, though, that it would be nice to see this at a lower price point, maybe as a starter, maybe as a pilot, see if we can do something smaller, just to feel each other out and see where it goes. But it's very hard to engage teenagers, and programs that do it well, I think, are worthy of investment. All right, special service for groups, West Hollywood Street-Based Transitional Engagement Program, STEP. Commissioner Wyville.
I don't have anything on this one.
Commissioner Ayers.
Just seems like duplication of already established services, so I'm not inclined to pursue this one.
Commissioner Borelli.
Same, especially as it goes towards thinking about our chronically homeless. We're covering that quite a bit.
Commissioner Palmieri.
I'm not decided on this, I'm sorry.
It's okay. Commissioner Steele.
I'm also not inclined to pursue this one. I think I said it's a duplication.
Vice Chair.
I'm still marinating on it.
I am also still marinating on it. I did not realize until I started reading the proposal it's APAIT, which I know has done incredible work for the community. So I would also like a little more time to think on this one. But the challenges in the duplication of services when we already have groups in the community doing this similar work. Nothing else on that one? We are at Tarzana Treatment Center, Inc. Substance Use Disorder Patient Navigation Program. Commissioner Steele.
I would like to know if there's any feedback from staff on the current existing programming that we can chat through.
In regards to Tarzana?
We'll cover all questions when we go through the Q&A, so we'll write it down.
Great, thank you.
Commissioner Palmieri?
I'm in full support of this. It just came back. And I believe that they are only medical detox facility that we're using at this, that are with us at this time. Am I right on that? Okay.
Commissioner Borelli?
I'm with Commissioner Palmieri. I struggle with this. I don't always know if they're doing the best outreach or the most targeted outreach, but being that they do the detox, I think it's important to keep in the fold.
Commissioner Ayers?
I agree.
Commissioner Wyville?
Agree.
Vice Chair?
They've been here for a while, so I like what they do.
Great, I agree. Maple Counseling Center, Counseling Services. Commissioner Wyville?
Maple is not one of our fee-for-service providers, correct? It's the, yes, I remember the lovely presentation for Maple. I'm a big fan, and I believe it's up to a certain number of sessions that an individual can receive, and I think that's great. It seems very low cost, low barrier, and the actual proposed cost is also pretty low. So inclined to support this again.
Commissioner Ayers?
I completely agree.
Agree.
Commissioner Palmieri?
I also agree. I think this is not a lot of money.
Commissioner Steele?
Agreed.
Vice Chair?
Great bang for the mental health buck.
I agree, and I liked that part of their marketing strategy was to focus on wellness centers in the city, gyms, yoga studios, et cetera, et cetera. I thought that was very creative and a nice approach to reach new clients in the community. We are at the Trans-Latina Coalition, Transforming Resources and Unveiling Excellence, their TRUE program. Commissioner Steele?
I don't have anything on this one.
Commissioner Palmieri?
I haven't made an absolute decision, but I need to say out loud that I am extremely in support of the trans community. I have many trans friends. My best friend is trans, actually. And this is a lot of money, so I really have to roll this over in my head, but I am in full support of all trans folks.
Commissioner Borelli?
In our last cycle, we ended up giving Trans-Latina Coalition more money, and they meet their goals. So I'm in full support of this, but I agree it's a high price.
Commissioner Ayers?
I am very supportive of this one. The Trans-Latina Coalition does, it really provides wraparound services for their community. So it's not like they're providing, job support or, living skills or things like, it's everything, including engagement with their own community and showing them what's possible in their lives. So I'm just very supportive of this. Can't say enough.
Commissioner Wyville?
Agree, and I also think it's just important to make the point that, as this campaign against trans people continues to grow and grow across this country, more and more trans people are going to continue to come to safe places for trans people, and it's organizations like the Trans-Latina Coalition that bring them in. So this feels like an important program, but at an even more important time.
And Commissioner Palmieri, you need something else?
I just want to thank Commissioner Ayers because you may have opened my eyes on a few things with this, and I always want to acknowledge that. I still am not decided, but you've given me a lot more information.
Commissioner Steele?
Yeah, thank you. I have been a longtime supporter of Trans-Latina Coalition. I think I'm just looking at the money. I think the investment is certainly worth it. My only question for staff is, do we have a breakdown of additional funding that TLC receives from the City of West Hollywood?
I'm sorry, Commissioner, can you repeat that?
Yes, do we have a breakdown of the additional funding that TLC receives from West Hollywood through other programs?
We'll get back to you on that.
Thank you.
Vice Chair?
I have concerns, and I'll leave it there.
I agree. I think Trans-Latina Coalition has done incredible work for the community. I've been a longtime fan of their work. I do have some questions about the price tag, but am really grateful for the services that they've provided the community, and agree with Commissioner Ayers that they really truly are wraparound from everything from a hot meal and some clothes to helping them get a job or an education or getting them into housing. So I think that if you talk full service, this is an organization that does that. And nothing else on that. We will go to the next, which is...
I'm sorry,
Oh, yes.
Chair, before we move on, just a clarifying question for Commissioner Steele. You're asking if there are maybe other departments in the city that Trans-Latina Coalition works with and gets funding for services and things? Thank you. Just making sure I'm understanding. That's what I thought.
Great. So next up is Van Ness Recovery House, the LIFT program, Learning Independence Future Training, Foundations for the Future. I believe we're going over to Commissioner Wyville. I'm going to start it with Commissioner Ayers.
Okay. I do have some questions about the history of Van Ness. I think that they've been contracted in the past, but now they're a new applicant. So I would like the staff to just kind of fill in the history of the city's relationship with Van Ness. I think this is, I'm inclined to really support this. I think that this program sounds fantastic, but I would like more info. Thank you.
Commissioner Borelli?
I was glad to see Van Ness back in the mix. I would have asked for them to go to fee-for-service. It was strictly for housing. But since it is GED prep, job training, employment education, independent living, well, if folks are there, I think it's worth the money.
Commissioner Palmieri?
Van Ness House has been with us for many, many, many years, and even when they didn't receive funding from West Hollywood, they assured us that they would take West Hollywood constituents, and they did, and I know they have. It's one of the places that it's legendary for folks getting well there. I think any other program that they do is, it seems to me like they just can't fail in what they do. And when I see recovery and GED, job training, and career coaching all put together, it's very exciting to me because I watched the GED program blossom at the LA LGBT Youth Department. So I'm a full, very strong yes on this.
And just quickly before we wrap, Commissioner comments on this particular one. It is 8:15, and I believe we need to make a motion to extend the time, correct? So does anyone want to move to extend the time?
So moved.
Second?
Second.
We need a roll call?
I'm sorry, extend the time until when?
Until we're done.
Gonna be a hard no for me.
Okay, quick roll call. Commissioner Borelli?
Nay.
Commissioner Ayers?
Yes.
Commissioner Palmieri? Yes. Commissioner Still?
Yes.
Commissioner Wyville?
Sure.
Vice Chair Williams?
I've had coffee. Let's go.
And Chair Adelson?
We will do our best to get out of here
Approved.
before 9.
Thank you.
Yes. All right, Commissioner Steele, Van Ness Recovery House.
Yes, I'm in full support, and I would suggest more, to be frank.
Commissioner Wyville.
Yes, I would like to give Van Ness another go around. I think job training, sort of, employment, educational work. I think this is all great. I think we could use more of it. That's all.
Vice Chair.
Well, this has been around for a while, and I remember having a tour, and it's a lovely space. It's very safe, and they do great work. So, and the amount they're asking for is very fair.
Agree. All right, next up is VLS Capital Drugs Prep Navigators Program. Commissioner Wyville.
Love VLS Drugs, great organization, great pharmacy. I'm concerned about duplication. That's kind of all I have here.
Commissioner Ayers.
I really like this. I'm familiar with Capital Drugs' long history. It's part of the West Hollywood community, and its focus on helping people navigate PrEP and PEP to make sure that they get the medication and they stay on it. I understand that like Men's Health Foundation also does this sort of work, probably APLA Health, but so many people trust Capital Drugs. It's such an important part of the community that they would do it might bring some people there and really get on a program that works for them. So I have to be a supporter of this.
Commissioner Borelli.
Agreed, and especially as Russell mentioned, given that the LA LGBT Center is no longer on a West Side location.
Commissioner Palmieri.
Capital Drugs has a long history of working with the community. I don't know if anyone knows the history of Capital Drugs, but it was Ruth Tittle's brother that started it. He had HIV, and he made her promise when he was dying that if anybody didn't have money or insurance, that they did not leave the building without their medications. That's always really beat at my heart. It seems like a little bit of a high ask, but I'm inclined to say yes with this.
Commissioner Steele.
Sorry. Agreed, I'm in full support. This is the fabric of the city. We talk about our history, we talk about our roots, we talk about our community, and I think this is very much wrapped in and a part of that, so full support.
Vice Chair.
Well, I just love Ruth Tittle, and Ruth Tittle worked endlessly before she left the city of West Hollywood to honor her brother. She's a woman of honor and of kindness, and anything I could do to keep her legacy alive and her brother's legacy alive and save lives, I'm about it. So yes.
I agree, and I also like that this would support a local small business. I think that kind of just double clicks on our drive to make this community great. So, all right, next up, WEA.
Sorry, before we move on, can I just make one comment? I think I responded, it may have been either harsh or not clearly stated, but when we were talking about Tarzana, I think I was reading double and reading something separately there. I was looking I had a little more feedback from community on some barriers in treatment, and I think I was just looking for some results in the most recent service provided, but also understanding that it's the only medical detox that sway me. So I want to follow Commissioner Palmieri's suit and acknowledge when my mind's been shifted. Thank you.
Great, thank you. All right, next up is WEA, HIV Integrated Street Medicine. Commissioner Steele, are you ready?
Not at this time.
Commissioner Palmieri?
Please come back to me.
You got it. Commissioner Borelli?
Yeah, this is a tough one. I mean, it's a great program, but it's almost double duplicative to what we're providing on the street currently.
Commissioner Ayers?
I really like this program. It's so much money, and maybe we can do a smaller scale version of this, but this is really about testing unhoused people for HIV and other sexually transmitted infections, and that's the final frontier of ending HIV as we know it, is getting the unhoused population tested on a treatment that they can manage. So anything that supports that, I really have to be for. Perhaps maybe not at this price tag, but maybe something can be worked out.
Commissioner Wyville.
Yeah, I echo those concerns. Great. It seems like a wonderful program, but it does seem the cost does seem high, I think, compared to some other providers.
Vice Chair?
No comments at this time.
I agree. I like that the proposals the program's led by community health workers. I think that was a bonus, but agree. There's a lot of other organizations that are currently working in the community that do similar work. So, yes.
I found my notes. Thank you. I'm also worried about the cost and the duplication of service. I wonder if there's a scaled version or something else we can look at. I do think it's important. There are other organizations providing it. But this is going to be a question as we move into the 22nd. How are we going to look at some of this and do something a little bit smaller, a little bit more narrowed in? And is that going to be accepted by council or the programmer? So.
And is it supportive of another one? Or yeah. Commissioner Palmieri.
This looks like a wonderful program. I'm sure they do great work. At this price point, I just can't repeat a service. Maybe if they came back with something trimmed, I could say yes, but at this point, I don't think I can support this.
Thank you. Next up is World Harvest Charities and Family Services, World Harvest WeHo Food Access Program. Commissioner Wyville.
I don't have much to add here. It seems like a great program, seems similar to some others that we've had apply, and I think the cost is on the higher end. I will take another look while you all are discussing, but that's my initial.
Commissioner Ayers?
Yeah, I agree with that. We have existing providers that also have a pantry outside of West Hollywood, so do they. I don't want to replace our existing with another one that people would have to get used to. It's a lot of duplication, so I'm not inclined to pursue this one.
Commissioner Borelli.
Definitely interested, and I thought the goals were extremely ambitious. I was also concerned about their logistics.
Commissioner Palmieri?
I'm very much in support of this program. I'm not in support of the price tag. And I think anything, like I said before, anything that has to do with food distribution is okay by me. But the price tag is a little high. I would consider it if it was a little bit lower. At this point, I just think it's a good program.
Commissioner Steele?
Yeah, I'm aligned with Commissioner Palmieri. I think it's duplication, but we've heard again and again about food insecurity from the community. So I just think we're going to be in a new landscape of factoring in what lies ahead of us with all the recent cuts and what folks are going to be facing in terms of rental assistance and food insecurity in these items. So on one hand, yes, it's a high price tag and it's another food service program. On another, the landscape ahead of us in the next 6 months, 9 months, and so on is treacherous. So
that's a good point.
we have to take a good look at it.
I like this program. I like the fact that, the food insecurity is an issue here in Los Angeles, in the United States, in the city of West Hollywood. It combines food with case management and behavioral health services and some other medical and housing placements. I mean, it is a lot of money, but I like what they're trying to do. And also, I think this is a good place for them to have some sort of liaison or synergy with other nonprofits to be of service. So if they're out there doing the reach and the giving food, and there's an HIV or an STI or a housing placement issue, this is where we play nice, we play well together, and we for the sake of community.
Commissioner Palmieri?
I just want to make a comment. Listening to Commissioner Steele and Commissioner and Anne Marie, I forgot your last name. Well, how crazy is that? Commissioner Williams.
It's very Mexican Williams.
I'm just tired, I think. The price tag is high, but yes, indeed, we don't know what's coming down the pike. So, I just want to acknowledge that I'm listening to my colleagues before I make my decisions too.
Thank you. Nope, LA LGBT Center. Yep. Nope. And I agree. I think that's the purpose of this forum, is for us to hear from each other and gain additional insights and then get some questions answered. So this has been incredibly helpful. I agree. I mean, and thank you, Commissioner Steele. What a great and sobering point that we don't know what's around the corner. And hunger is a big issue now, and where is it going to be? And so I think as we look at this, like how could these partners all potentially work together to feed as many people in this community as necessary? Should be super easy. Yes. Yes, that's where we're at now. No, that's all good. No. Stick around a little longer, folks. We have, next up is the LA LGBT Center Senior Services. And I will begin over with Commissioner Steele. If you're ready.
Sorry, no, my piles of paper were blocking my mic. I am in support of the Senior Services program and the programming that they're doing. We've heard more from our, like I said, older adult board about the services, great feedback on the services, and they're looking for expansion. So I just want to echo their sentiments and make sure we're centering their wants and asks.
Commissioner Palmieri.
I wish I could find my notes, but I'm so confused as to where we are. But I know,
now we really jumped around. So
I know what I want to say. I'm in support of these senior services, but I am doing it with caution because the senior service programming at the center was very ambitious at one point, and they did not reach their scope. And I never want to set anyone up for failure. So I'm going to really think about this, but I'm in support of their program.
Commissioner Borelli.
Support.
Commissioner Ayers.
Support.
Commissioner Wyville.
Support.
Vice Chair.
Our elders are everything, so yes.
I agree. All right, next up is Los Angeles LGBT Center Sexual Health and Education Program. Commissioner Wyville.
A big supporter of this program. I know that the center's West Hollywood location is no longer where it was. So that is, I think, part of this to take into consideration. There's so much familiarity with the Hollywood location. I don't think it's the biggest issue, but if there's an opportunity to invest in a local business, that is a local pharmacy that's doing this work, maybe this is one of those opportunities here, especially given that the center has closed its West Hollywood location. I think this program, of the many from the center, I think this would be the one that I would be least concerned about.
Thank you. Commissioner Ayers.
I like Commissioner Wyville's approach to this.
Commissioner
Nothing more
Brown.
to add.
I had a hard time hearing that approach.
I'm sorry, I never speak loud enough.
I know. I support this, but that price tag is way too high for me.
Commissioner Palmieri.
I fully support this. But the numbers are very high, though.
Commissioner Steele.
Same, I support it. I like Commissioner Weibel's sentiments. I love looking at that cross-pollinating, especially as we're going to have to figure out how to ravel and then unravel it all. I think that it's a really high spend, and I think with an organization like this, we also have to look at just the overarching funding that's received. There's a lot of funding, and some of the cuts that we thought were happening, and there's money coming from other places, and I think we need to look at it from not a panic perspective. I'm not saying we all are here, but I think sometimes that happens, so I just want to take a deeper dive on it.
Yeah, thank you. Vice Chair.
I'm Team Wyville. I share your sentiment on this. Thank you.
I agree with Commissioner Palmieri.
Okay, everybody is referring to what you said, and I didn't hear a word of it.
I'm happy to repeat it. I can. I apologize, and I will speak louder. I'm a fan of the program. I think that of the many programs that the center does offer that we contract with, this is one that I am less concerned with losing, given that it is a somewhat duplicative service and the West Hollywood location no longer is there. And if we feel that the services that we do contract with already still needs replacement, there were some, great local ones that could fill that hole. Or a better cost also.
Thank you, I appreciate your comments.
I will speak louder. Thank you.
Do you have anything to add? Commissioner Palmieri, you good? All right, Vice Chair. Oh, yep, you're right. All right, then we're all here. I'm doing great. Okay, LA LGBT Center, Survivor Services, and Legal Services. Commissioner Steele.
this is an area that I am definitely in support of. Yeah.
Commissioner Palmieri.
I don't have a lot to say on this, but I'm leaning towards supporting it.
Commissioner Borelli. Commissioner Ayers.
I support this one.
Commissioner Wyville.
Nothing to add.
Vice Chair.
A great organization. They're asking for a little bit, I mean, great services. They're asking for a very fair amount. I think they're totally necessary right now because as people, yes, I'm not going to ramble on. Yes, I'm supportive and they do great work.
Great, great. I agree. From all the proposals we read, this is the one that stood out for survivors of crime and domestic violence as one of the only, few, if not the only. So agree. The LA LGBT Center Trans Lounge. Commissioner Wyville. That's a new one.
Yes. I have my notes. I just one moment.
Do you want me to start?
Yeah, Commissioner Steele, if you're ready.
Yeah, so I think in a shocking twist, I'm going to probably be the dissenting voice in this only because I feel like this is funding that could come from another space. I'm curious to see where the funding's come from and where that funding's gone. We also do quite a bit of spending in the city to support the trans community, and so I think it's a good program. I've supported the program personally, but I don't think this is one that necessarily would fall here. I think that there's money that can be spent in other areas of the city's budget.
Commissioner Palmieri.
This was one proposal that I went back to. My first read, I wasn't in support of it, and only because of the amount of money. And when I went back, I thought maybe I would change my mind, but I haven't changed my mind. I'm in support of the program. I'm just not in support of the amount.
Commissioner Borelli.
What they said.
Commissioner Ayers.
I'm a supporter of this, just because it's about creating a safe place for trans people, and I think that's just super important right now. It's at the center. Yeah, it's hard times, and the more safe spaces the trans community has, the better.
Commissioner Wyville.
This is another. Oh, there we go. This is another one that I also am still thinking about, and not to say that this program doesn't focus on health, because it absolutely does, especially mental health. I think. I think being in community and having these spaces is really important for mental health, especially for trans people. But yes, it is also a high price tag. So this will be one of those tough decisions we have to make.
Yeah. Vice Chair.
I don't have a problem with the amount of money, and I think creating a space for trans folks is important. The more spaces, the safer spaces, I'm all about it.
I'm also still reviewing this one for the reasons that Commissioner Steele brought up and the reasons that Commissioner Ayers brought up. So I thank you both for your feedback. All right, LA LGBT Center WeHo Life. Commissioner Wyville.
Of course. I love this program. I think it's fabulous. And it is one that I know for certain reaches people. I think that every time that the center has come back to report its progress on this program, their numbers have always exceeded expectations, which is wonderful, and you love to see it. I am concerned about the cost, I think especially compared to one of the other programs that I remember reading earlier, but I think it's wonderful. And I think that every community member that I know has had one of these WeHo Life distributions given to them in their hands.
Mm-hmm. Commissioner Ayers?
Yeah, I think this is a really important program. They're an important part of pride here in the city and elsewhere in the LA metro area. Even though this is coming from the LA LGBT Center, they've made a really big effort to make this a collaboration between the center and other organizations to the point where they've removed the center's logo from their materials so other organizations feel like they're really truly part of the collaboration. And I know that high price tag probably covers a lot of resources that they give away. These are resources that can save lives and extend lives. So I support this.
Commissioner Borelli?
I continue to struggle. WeHo Life, I think it's a great program. I don't like that they still don't reach to Sunset or Melrose or Beverly in the party zones, because I think we have a lot of non-LGBT folks that need to be reached as well with harm reduction resources besides just Santa Monica Boulevard. They haven't always reached their goals in the past, but they've certainly been better recently. I think the price is too high. I would support it at a different price level.
Commissioner Palmieri?
This program has been with us forever, and I can remember the original condom guy pushing a carriage down the street with condoms in it. But the price is high, but they do so much. They work really hard. I know they work really hard, and I'm okay with spending it on this.
Commissioner Steele?
I'm aligned. I wanted to, I guess, piggyback off of something Commissioner Ayers said, because I think it was really important. You were talking about the name and the branding and the separation, and I think one of the things we've heard repeatedly from community and the feedback forums and our boards and commissions is about awareness and communication. We have a comms issue. People don't know about programs. Some people think plenty of people know about our programs. Some people don't. Many, many times we've gotten that feedback that folks don't know. And the reason I'm saying that, and this might be a little bit of a, I don't know, curveball. I'm not even sporty. I shouldn't try to make a curveball reference. But is that, for example, with like the Trans Lounge, which something like that, sometimes I feel we spend money and the community receiving that funding has no idea it came from West Hollywood, and then I sit through council meeting after council meeting with the same community members, and I'm highly involved with the trans community. I can list plenty of spaces that are similar, that offer safe spaces and all those things, which I duly support. But a lot of times I feel we offer this funding and the community recipients don't know. That doesn't mean we have to be centered or take away from the core messaging of the program, but I do think when we do some of these things, I think we've got some branding issues, I think we've got some support service issues and awareness issues, and I think that has to be added back to the comms conversation. So I'd like the body to factor that in with staff as we move forward, just in general.
Thank you. Vice Chair?
They have been here for a while. I mean, I remember sitting in meetings and discussing design and involving other ethnic makeups in their marketing. It's a lot of money, so I'm concerned about that. But they do great work. It's a large price tag.
I'm just curious, as far as their financials, how much is donated in kind for this kind of program, and where there might be ways to reduce costs on this, and getting volunteers from the community to help pack some of the kits and those kinds of things, because I agree 100% this cannot go away. It's just, obviously, we have some hard decisions to make as far as the budget's concerned, and so if there are opportunities to reduce this cost, I'd love to know a little bit more.
Chair, before you move on, I really want to highlight what you just said, because we've been talking a little bit as we've gone through this about connectivity, finding space for community, finding space for folks to get together with activities. That's a perfect example. There are some of these things where we can enlist our community, all parts of our communities to support in some of these programs. So as we're starting to whittle things down, that might be a good way for us to look at it and see, have staff tell us what we can or can't do in that realm, but we should push.
I'll volunteer. Okay, last one, LA LGBT Center Youth Services. Commissioner Steele, do you feel ready?
I am generally in support. I think I just need to spend more time in terms of the dollars, but I think they offer great services. We get great feedback on the services. It's important. And we know what it means for our youth, for LGBTQ youth specifically, so I'm in support.
Commissioner Palmieri.
I'm in full support of this program. I remember when it was just a little storefront, and the younger folks would go there and sleep during the day because sometimes they were walking the streets all night. And I've watched it grow. It's expensive, but I think it's worth these particular kids are worth spending the money on. So I'm in full support of this.
Commissioner Borelli.
Support.
Commissioner Ayers.
Yeah, this one's important. And I'll tell you, they've evolved over the years. They do respond year to year. And, you know, it used to be that it was gay kids from Kansas coming in, right? And now it's mostly trans and gender non-conforming kids who are showing up. Not all, but that's their, you know, who they're serving. And so, yeah, we got to be there for them. So, yes.
Commissioner Wyville.
Agree. This is a lifeline for a lot of LGBTQ youth.
Vice Chair.
I, like my fellow Commissioner Palmieri, I've watched this grow, and it does great work.
Agree. All right. We made it through part 1.
Yes.
And there's
Part
only
one.
7 more parts to go. Thanks, everyone.
I have a comment,
Yes.
quick comment. I wanted to remind the commission that we are still in the negotiation phase. Nothing is finalized today, just so to make that clear for the audience. At the July 22nd meeting, we'll be meeting again. It'll be another live meeting. Staff will have our recommendations, and we will negotiate at that point to decide what we will bring to the council. Also, if we decide that we would like to engage one of the participants, we have the opportunity to negotiate in terms of scope, in terms of funding amounts. And so nothing is set in stone right now, so we'll have that opportunity in the future.
Excellent. Thank you.
Thank you.
Appreciate that clarity. So now we move into the applicant response session. How would you like us to handle this? Staff is taking over from here? Great.
Thank you so much, Chair, Vice Chair, Commission, all the agency partners that have stuck around. We appreciate you. So, Commissioner Still, I want to throw it back to you. I'm so sorry. This is what happens when you have 18 people working in one document. So the first question that you asked with APLA Health and Wellness for the housing support for seniors and persons living with HIV, if you could just restate that question, and while that's happening, if we have anyone from the Alliance for Housing and Healing, APLA's housing support for seniors and persons living with HIV, if you can please make your way to the podium so that you can receive this question.
If they aren't here, we'll move on.
If they're not here, yeah, we'll move on. But if you could just restate your question, Commissioner, still for the record.
Yes, I actually had a couple questions, and one I forgot to ask. Can I add a question?
Yep, you
okay,
sure can.
cool, thank you. Good time. They had talked about working with property managers for residents, and I was asking some of the feedback we've gotten from our Older Adult Person Advisory Board and our Disability Advisory Board was about emergency service, emergency preparedness, and communicating with folks that need to be reached literally where they are. And my question is, do they or can they work to develop a program where they actually can help with outreach for emergency services and emergency weather or climate or situations like the fires? Yeah, thank you. And then my other, no, that one's not there. Yes, bi-weekly staff meetings to monitor progress, review feedback, and adjust practices. And I probably, in fairness, should have asked this of everybody, but when these bi-weekly meetings are happening to review and adjust as needed, what's the communication flow with the city at that point? And at what point do we, and I think this does go for all providers, but at what point are we reevaluating, and at what point are we doing some check-ins, checks and balances to check in on programming? I got the third answer from Commissioner Palmieri at some point.
I'm really confused what we're doing right now. What are we doing?
So, Commissioner Palmieri, the questions that were posed during
Yes.
the discussion, we were over here logging them, and so now we're going to invite the agencies up that are still in attendance so that we can pose those questions and they can address you all as the commission and provide those answers and any additional information that you may need.
So just for clarity for me, didn't the agencies provide these answers?
So there are some that that are included in your packet that were asked in advance. I want to say the cutoff date for that was like July 1st or something. So those have been included. But then now today with this discussion, as other questions have come up while you all are discussing this with each other, other things ringing in your head, we're giving our agencies an opportunity to respond to those questions so that it can help us as we make our recommendations at our next meeting.
Well, thank you for doing that, and I have no questions.
Thank you.
I do, of course. I mean, how many questions are we talking about?
There aren't that many. You all had some really amazing points that you were making and discussion about it. So question part, not so much.
And then secondly, Madam Chair, do we have more public speakers?
If they're still here, yes.
Do you have any idea how many? Okay, let me be clear. I'm leaving no later than 9:30, wherever we're at. Okay?
Understood.
Okay, with that, so APLA is not in the audience, so we're going to move on to the next question. The question is for Essentia. Commissioner Weibel requested the last 3 years of the program costs and the funding chart. So just for the record, I'll state that Essentia is currently funded at $395,309, and we can follow up with the funding charts at a later time. Okay,
Yeah, we answered Awakening Recovery. So the next question is for Beitzedek. Chair, you had inquired about the 1,004 West Hollywood residents who will receive services. And so someone from Beitzedek is here now, and if not, if the program administrator has a perfect. So the chair asked the question of, please feel free to come up and take the podium. Chair Adolphson asked the question of if that 1,004 that is included in your scope of services in your proposal, if that is based on past experiences, where did that number come from?
Sure, let me see. Hi, good evening. Thank you for having us here. My name is Henry Sabassi. I'm the directing attorney for the Preventing and Ending Homelessness Program at Beitzedek. The 1,004 has come from past experiences. It comprises legal advice, eviction defense, court representation, as well as what we call limited scope services. For example, some people say, you know, I just need to ask my landlord to help me with repairs, or I just need to tell them to stop harassing me and I need a letter. It comprises all of those things, and that's from our past experiences.
Wonderful. Thank you so much.
Thank you.
I think, Commissioner Palmieri, we have the same microphone. They've got to be twins. So the next question, if there's someone in the audience here from Block by Block, our next question is for your organization. And there's a couple of them. So the first one, as you heard the commission discussing, would Block by Block be open to your proposal becoming a pilot program instead of it being something that is fully funded on the 3-year grant cycle? And it was also noted by our chair, if you have any data or qualitative stories or any information that you can provide from the success of this program in Santa Monica and how it's going.
I can answer both of those. Thank you very much. Thank you, commissioners, for the opportunity to present. You have some amazing proposals in front of you, so congratulations. I will say, I am Chip. I'm the division vice president for Block by Block. I think many of you know Erica Hernandez, who's our manager here in West Hollywood. We've been your partners for the city for 20 years. In the public safety realm, as was mentioned. I did want to clarify, we also do a number of outreach programs nationwide where we have about 50 programs. We've been working in this space for a little over a decade. Here in Los Angeles County, we do outreach in Old Town Pasadena, Westwood, Long Beach, and as was mentioned, Santa Monica. And so we do that sometimes in concert with public safety programs, sometimes independent of it. So I just wanted to make that distinction because I know you know us through our partnership in public safety here. So I don't have stats from Santa Monica. I have our director of operations from Santa Monica. So I'm excited to introduce you to Donovan Wilkes, who runs our program there and has been doing an amazing job in the community. So with that, just kind of reiterating national best practices, which are evolving and growing constantly, and our work throughout the country really helps support that, but also the local resources that we have through Donovan and his team and the other people who work in the area. So I'll introduce Donovan, who can speak to Santa Monica's successes.
Thank you, Chip. So I had thought that there's going to be a timer, so I have like a little script prepared, so I might be running through, but please feel free to ask any questions as you feel necessary. So to address the chair in your questions in regards to the stats for the Santa Monica program, using last year's numbers. So last year, the program saw 4,500 referrals to resources, 1,500 case management interactions, and we help with 40 permanent supportive housing placements without having our own shelter, and with a small but mighty team of 4 of us, most of us being a BIPOC, and then with lived experience as well. I'd also just like to add that Block by Block's outreach approach understands the importance of building trust and provides a thorough helping hand with system navigation, especially for those with unique needs. We prioritize problem-solving strategies. For example, this would be how we work with the City of Santa Monica's Project Homecoming, which is a family reunification program. Just last month, actually, we helped get 3 people connected back to their family. Our resourcefulness has benefited the community as a whole. For example, our program is now an authorized provider with the LIFE program, so we connected with the Metro's LIFE program to provide free bus passes to not only to our clients, but to our local agencies as well, being a big supporter to just provide those bus passes to our agencies so that they can provide it to their clients directly. And of course, always thinking of big picture solutions, like collaborating with our ambassadors, with the City of Santa Monica, and with regional partners too, like LASA and DMH, constructing Connect Days that bring together different organizations directly inside of our locations, inside Santa Monica. Organizing the city's homeless count, we played a leading role in that the past 2 years ourselves. And fulfilling our role inside the city's ecosystem of homeless services, boasting a large footprint of boots on the ground for providing access and engagement for our area.
Thank you so much. No, that helped answer my question.
Sorry, I realized I didn't answer the first question at all. We're absolutely, like our proposal.
He answered my question.
It's an ongoing conversation. So, our proposal was based on, what we understand and see the needs are, and really we're your partner. We'll work with you to create a program that works for the scope and the budget and whatever that looks like. So we're always here to talk. So thank you so much for your time. Appreciate it.
Thank you.
Thank you. And Eugene, as you make your way up, the questions for the Coalition for Economic Survival, there were a couple of them, so I'm going to say them as they were presented and just kind of reword it for you. Of course. And so you were asked to provide a comparison between your work and Bates-Zedek, and I think that it would be best appropriate for you to just maybe, I'll give you a brief description of how we inform community members about Bates-Zedek and their services, and you can let us know if there's any overlapping or if there's something in addition to that CES offers, and then if you wanted to just briefly talk about what your contract looks like with rent stabilization. And so the way that we inform community members about Bates-Zedek is we define them as an agency that provides free legal services and advocacy for community members. These legal services include eviction prevention and defense, housing and habitability, benefits advocacy, workers' rights, and Holocaust survivor services.
Thank you for the question, and I'll start with the very first one that actually started the conversation. So why we are actually applying for the Human Services Commission is that before we were on funds that were emergency funds through the COVID emergency funds. So now we actually moving forward with kind of like being on a permanent basis with the city, continuing a 5-year program that we've been doing for the past 5 years, working and serving the community in West Hollywood. Numbers are growing and extreme need for our services is growing. My personal numbers and cases doubled or tripled in the last few years. So that shows how many people are in need of services. The difference between what we do and Bethesdic does is we refer people to Bethesdic in case when people, tenants, need full representation. We provide legal clinics twice a week when we advise people on their tenants' rights. We provide legal advice. We have best attorneys that you can get in Los Angeles. You know the case of Barrington Plaza, right? Where we actually made one of the biggest victory in rent stabilization history recently. So even those attorneys who won those cases volunteer with us in our clinics for free, providing services to West Hollywood residents on a weekly basis. This is what we do to our residents. We help them get those services. It's a one-on-one personal consultations. It's not a group setting. They can call. I do the intake, I follow up, I do case management with individual cases. We also work with outreach through clubs, through events, through public events. We just did multiple public events, including our older adults fair. We do all the public events with the city where we have our tables, our flyers. We outreach personally to the houses. We provide flyers. We go door to door. We work with the community, basically telling them that if you need services, we are here for you. All our services are free, and you're welcome to get the best qualified support for legal services. The difference is when it's out of our scope to provide full representation for unlawful detainers, this is where we actually pass our cases to Bethesdic for full representation. This is the difference between us and them. Because a law firm like Bethesdic is actually contracted with the city to represent unlawful detainer cases. This is their contract, on par with other stuff. So we actually work together. We have made a couple of great strides towards the fact that we work together when we do warm referrals from our clinics and from our intakes. We actually work together greatly, and it's a great collaboration. And as you know, nobody can solve all the problems ourselves, neither do we. And this is why I think collaboration with other nonprofits who serve the community is so important. Because working with other people who serve the community is important.
Thank you, Eugene. I think that really helped answer the question, and I think only for the sake of the evening and making sure everyone gets to say their bit, if we can add timers.
Yes, we'll do a 2-minute timer for all the answers, okay?
Great.
Okay, thank you.
That's it. Thank you so much. And then the next question is for Community Bridge Housing Corporation. If you are still, yes, you are, okay. And so, as you heard during the discussion, the question posed to you tonight would be, where will you all be housing people, and how do you plan to get the housing?
That's a big question, thanks. It's my fault that question wasn't answered in the proposal. We don't have grant writers. We're a small nonprofit based out of Silmar, California. We have homes in the San Fernando Valley. Our Silmar location is a 50-bed public health licensed interim housing facility. And then we have smaller residential properties throughout the valley. In Tarzana, Reseda, Van Nuys, and Panorama City are where we mainly have residential homes. When we receive people, we take them to Silmar first, kind of triage them, get them, figure out what they need, and then figure out what home would work best for them based on their needs. If we can't reunify them with family, some people need mental health treatment, inpatient. Some people need to go to Tarzana Treatment Center. Some people reunify with their families, different things. So we kind of triage them and figure out where they need to go. The way that we got here tonight, I'm sober myself. I lived on the streets. I have lived experience. I lived on and off the streets of Los Angeles for over 20 years. When I got sober, it was in the valley. I lived in Hollywood on the streets. I lived everywhere. And when I got sober, it was in the valley, so I kind of stayed there. The reason that I started these homes 21 years ago was because the rent was too damn high. And I work with places like CES and a lot of these agencies that I'm hearing about here. And we couldn't afford it. So me and my friends from AA meetings got together and opened up homes, and we chipped in and paid the rent, and people liked it, and more people came, and eventually as homelessness exploded, I didn't like the fact that sober living homes would kick you out on the street and make you homeless if you relapsed. So I adopted the Housing First Harm Reduction approach. I worked with the Sober Living Network. I ran the Sober Living Coalition for many years. I went and taught those sober living homes how they can't shoot their wounded. They need to help them back up and give them a place to stay, and implement those housing first and harm reduction practices with their existing capacity of beds that they have. So that brought us around to community bridge housing. We did that about 5 years ago. I decided I was going to retire. Our executive director, Jackie Chavez, couldn't be here tonight. But yeah, our homes are in the valley, and it's a fee-for-service model. It's based on our experience working with their existing providers, Healthcare in Action, the WeHo Care Team. They call us. We didn't just make up this number of 5 beds. It was 5 beds over this spring that were being filled by WeHo community members. And the reason they used this is because we were available 24/7. They would call us at night when other providers, the Sentia and other providers that didn't have beds, or they didn't answer
Thank
for
some reason
they didn't want them. We filled that need.
Thank you.
Super helpful information.
Okay,
Thank you.
Thank you. Amy, I'm so happy you get to be the bad cop in this arrangement. I'm over here like, yes,
You're me.
Okay, Defense Diagnostics, if you are in the building, please make your way. Please come up. So one of the questions that was posed was our chair saw reviews on Amazon. So what security can you provide the city if someone says that their testing kit did not work? Are we able to replace it free of charge?
Yeah, absolutely. Hi, commissioners. My name is Kevin Gordon. I am our public affairs manager for Defense Diagnostics. Just to be frank and respect the time, access is our biggest mission, whether that it was with our device being an all-in-one so that people can access it wherever they are, on the go, and test substances easily to prevent fatal and non-fatal overdose poisonings. To answer your question directly, of course, yes, absolutely, we would replenish devices. All part of coming back to access and making these products available for folks. Obviously, with any product and with any high volume thing that's out there, it comes down to user error. Sometimes there's faulty things that happen, but absolutely for devices that were out there, we would replenish them. We want to remove the operational burden from WeHo. We want to support all the different organizations, community-based organizations, nightlife, recreation, such as places like the Abbey and whatnot, and as well as our online program. So any way that we can get these devices into people's hands and support the access, remove barriers, and save lives and prevent unintentional fentanyl overdose. Thank you.
Thank you.
Thank you. As a representative of Jewish Free Loan Association makes their way to the microphone, the question that the commission has asked this evening is regarding the requirements. Is one still required to have good credit and/or a credit score in order for them to be considered for a loan? And is the programming open to the idea of offering services if you're partially funded?
Thank you for your question. So for a loan under $10,000, a borrower does not need a credit score. However, their guarantors will need a credit score and will have a hard credit check. And for borrowers over $10,000, they need a credit score, and we do a credit check, as well as we look at the credit of all the guarantors. And for applications, for all the applications, we need a proof of income from all borrowers and guarantors. And then for the question for the partial funding, we would love to accept partial funding if that's available, as we are eager to serve the people of West Hollywood. The loan fund, what's unique about it is it will serve the people in the long run because it renews. So once a loan is repaid back, it's put back in the loan fund to given over to more West Hollywood residents, so hopefully to build forward. Thank you all.
I think we have one more question.
Thank you.
Commissioner Steele.
So I just want to make sure I heard that right. So the folks receiving the loan don't need a credit score or credit check, but guarantors up to $10,000 and past all need a credit check for
Yes, so,
process. Okay.
so applicants do need a credit score for loans over 10K.
Right. So they need a credit score over 10K, but under 10K, their guarantors need a credit score.
Yes.
Okay. Thank you. I have a question thank you so much.
No problem.
Just for staff, I just want to make sure we don't get into a proposal pitch. So I think a lot of the questions are super specific questions. Is this required, yes or no? And then I think that needs to be the end of we're timing out of respect for all the public commenters, but just to be totally straight up with everybody, we did that for the public commenters, but we don't want to get into any further pitching or any other explaining. Just here's the question, that's the answer, and that's the best we can do. Sorry.
No,
thanks.
Take me to school, Commissioner Steele. Appreciate it. Okay. As we have WehoLife from the LA LGBT Center come up, your question, yes or no? Is there an opportunity? Paul, you can shake your head while you're walking down. And then you can just swoop and go right on back. Is there an opportunity to reduce costs in your proposal? Yes or no?
You know what? It's a good question. So I think we could definitely take a look back at how we can trim. We were very intentional with trying to make it very kind of bare bones, and I think to the comment earlier is all of our proposed budget is going towards materials that we'll be distributing. So we do use volunteers to assemble our kits, and we actually get a lot of in-kind donations for condoms and lubricants from our development department, our volunteer resources. We work with them with their corporate groups to do volunteerism. So. And also just to Commissioner Brawley, your just question about expansion, we think a lot about how to do this, and it really comes down to limited funding. Most all of our partners have been partners of ours for as long as I've been on the program, about 8 years. So to take the materials from one person to kind of move it to another provider or a partner, it's a little difficult without the funding. That's the idea around the expansion of the funding, is to kind of have the resource to do that. But we have been intentional with reaching out. So we just did a couple of digital campaigns to reach out to new partners in those areas. And we're moving towards the kind of second phase of that, which is going to be canvassing those areas and connecting with folks kind of in person and talking about how they could get involved in the program. But so this would be the first expansion of our program or our budget as long as I've been a part of the program, and I think even before. So we have been doing this work for a long time with limited resources, and a lot of times us being resourceful and kind of getting these donations and working with volunteers, and then also other funding sources kind of supporting the work that we're doing here. So yeah, thank you so much for your time, and I appreciate all your work. Thank you.
Thank you so much.
Thank you for the longest yes of my life. Remind me to not propose to you. Okay. I'm sorry, this is a televised meeting. I'm a representative of the city of West Hollywood in this moment. Okay, Nami, Westside LA, as you make your way up, I would like for you to really consider what yes means and what no means. And as we do that, this is the question that you would be responding to. Could this programming be expanded to include other types of groups, such as women, mental health groups, etc. I see the nod of the head. That's saying yes. Thank you so much. Have a great night. No, just kidding.
Yes, so solid answer, yes, we can. For just one example, right now we have an older adults support group. We also go to inpatient units. We've done sibling groups, so really any community that you all see a need in, we can train folks in. Thank you.
Thank you.
Thank you. Following NAMI, let's do, it was staff, but if you want to, yes, come on, Marjorie. So the question that was asked was, what happens when your programming at NCJW runs out of funding?
There were like 3-ish, I felt, but I'll take that one.
What do you do when you run out of funding for City of West Hollywood programming? This is NCJW, National Council of Jewish Women, that provides rental assistance. How do you alert the City of West Hollywood? What happens when the portal is closed?
Yes. Thank you. Okay, I just want to say, I'm not making a pitch, but just to say that there is no other program that provides unrestricted cash to West Hollywood residents other than our program. And Thriving in Place was just a play on the aging in place. It's actually not about seniors. In fact, only about 2% of our clients are seniors because there's a senior rental assistance program that we do not run. And about 88% of our clients are BIPOC, and low income. What I would say is we have other rental assistance programs, as the staff mentioned, that we internally can refer people to. We work with the city's other partners to, for if they're seniors, we can refer them to the Senior Rental Assistance Program. We have a network of other agencies that we work with who have funds for rental assistance, so we try to work with them in that space. And yeah, just wanted to clarify those points, I think. That's the gist. Was that the only other question, you think? Okay.
Thank you.
Oh, so I think also Commissioner Borelli asked if we could shorten the rental assistance, the number of months. Yes?
Correct, like potentially cap it at 3 months. My concern is if people aren't able to access because somebody's gotten 2, 3, 4 months.
Yes.
And somebody's now shut out, they can't even get 1 or 2. So that was my concern.
It's a good question. And we've been running this program for like 20 years. And it's changed a lot. When I came on board a few years back, it was a 1-month emergency program. The multi-month program has demonstrated to stabilize people significantly more. We now see about close to 100% of the people who get the multi-month support stay housed. When we were doing the 1-month support, we couldn't even find them to find out if they were still housed. So it is a consideration that we could potentially shorten. We graduate the payments, so they're not getting the same amount every month. Yeah, that's it.
Thank you.
Thank you.
Thank you. Do we have a representative from Planned Parenthood still in attendance? Okay.
And I found the answer to my question was in the proposal, so we can also disregard that one.
Okay. And do we have anyone from Trans-Latina Coalition in attendance? No. Okay, do we have someone still in attendance from Project Angel Food? No. Okay. Do we still have anyone from Rainbow Hill Enterprises in attendance? Okay. Do we have anyone from Rainbow Labs? Okay. I was going to say, we are over the rainbows. All right. So, yes or no question for you. Would Rainbow Labs be interested in a pilot program?
Yes, of course.
Awesome. Thank you so much. I appreciate you. Thank you for your service to the city of West Hollywood. Okay, now, next up, no, nobody here? It's, what? Yeah, but we're gonna, yeah, I'm gonna come back to that. Staff question, okay. Oh, a scaled version? Give me 1 second. Now I have to interpret my notes.
While they're waiting, can we ask how many speakers do we have left?
There are 17 slips. That does not mean that all 17 are here or that they haven't already spoken.
While staff is doing their magic over there, I just want to say to our speaker from the National Council of Jewish Women regarding the program, that was really helpful and really important information, especially with the multi-month programming and the 100% rate. So really appreciate that. I know it's been a long night, but really valuable, so thank you.
And actually, Commissioner Steele, this is your question for WEA CAPC. Asking about a scaled version. What is, I'm sorry, I have an incomplete question that I've jotted down.
I don't remember posing that question for WEA, to be honest with you. I don't know if that was my question.
I think it had to do with, would they be open to a scaled down
Oh, that was the
version?
one over. Okay, got it. Yes, I understand. I think when it comes to scaling the offerings, I think that just has to come from us after the deliberation on the 22nd, because that's going to be from staff. So I apologize, sir, but that's going to be between staff and us and then council. That's kind of a conversation that we kick back to the orgs, unless the commissioners just, okay. I don't think we need to. Yeah.
Okay, perfect. And then just to circle back to your question about Tarzana and staff's feedback on current programming. So at the June meeting, we did give our mid-year report. At that time, we had the Q2, and Tarzana is on target and exceeding target with outreach and engagement.
Okay.
Their intake and admissions are reporting significantly under annual goal.
Okay.
And then their residential treatment is all report actual, and to date there is nothing that's been reported.
Okay, thank you. And I was traveling for that meeting, so I will do my due diligence
good.
for everyone's application. Thank you.
And that is the close of questions.
Fantastic. Thank you so much, Dee. Appreciate all that. Which means we're on agenda item number 6. Excluded consent. There is none. Items from staff.
Hello, Commissioners. Just a quick announcement. The Disability Advisory Board is going to be hosting their annual Disability Wellness and Wealth Fair, taking place October 9th. We have also opened up nominations for the Disability Award. Those nominations are live and they will close on August 15th. Thank you.
Thank you. All right, no other items from staff?
Question for staff.
Yes.
Staff, was the Paul Stark Warrior Awards eliminated from the current city budget?
That predates me, so I don't know if anyone on the team.
We will come back to you on that.
It was not listed as a city event, so I'm curious about that.
We'll come back to you on that.
Thank you very much.
Thank you.
Thank you for that question. Any other questions for staff? No. Great. We will move into public comment. I believe in the interest of time, yes.
Yes, if everyone's okay, would you be okay with doing 2 minutes? Yes?
Absolutely.
Yeah?
Thumbs up,
Okay,
thumbs up.
thank you.
Great.
Okay, we
Thank
can
you.
start.
And we will begin with Councilmember Hang. Thank you for joining us.
Good evening, honorable commission members. Good evening, chair, vice chair, commission members, city staff, and members of the audience. I'm Councilmember Danny Hang, and it's my pleasure to be here tonight. I was watching your meeting diligently at home. I really enjoyed the cross conversation and listening to each other and learning different points of view, and I appreciate it. Commissioner Wyville, I heard you loud and clear that we need more pre-K support for our city. Our city is evolving, people are having children, so we need more programs. Thank you so much for all of your deliberation in helping keep our city safe, healthy, and supported. I've heard discussion on housing, harm reduction, addiction recovery, food security, finance with low interest, zero free loans, and the works. So I appreciate all the work that you all do and the countless hours and discussions with staff and with our stakeholders. Thank you and appreciate you. Thank you.
Thank you, Council Member. All right. Next up, we have Ashley Weinberger, followed by Jamie Farr.
Hi, my name is Ashley Weinberger. I'm a member, or I work for Los Angeles Centers for Alcohol and Drug Abuse. I know that was the one that y'all were like, hey, we don't really know much about you. I think Commissioner Williams, you said that you are familiar, yes? So I just wanted to clarify, I know I didn't get asked any direct questions, but also running on fumes. I flew in from Minneapolis this morning, so I'm really tired. But anyway, so bear with me, sorry. So just want to give you some history about us. We have been operating in LA County for over 50 years. We started as a substance use disorder treatment agency for Vietnam veterans who came back from the war with opiate use addiction. And from there, we've kind of evolved ever since. We have over 30 sites. It kind of changes a lot because we're always adding new locations. I know us being in downtown was one of your concerns. This is, at its heart, an outreach program. So our, like where I stay, doesn't necessarily play into it because staff will be here in West Hollywood. We already run we run several outreach programs in 30 different cities across LA County. So it's going to be kind of, just moving into West Hollywood. I know a question that we had at one point, a follow-up was, are we gonna be able to do, as many intakes as we had proposed? And for us, we have a harm reduction model of substance use treatment, so it's not just boom, residential. We try to take into consideration what everyone's needs are. So if someone, has kids or family that they're taking care of and they're like, I can't do residential, great, we wanna work with you. Even from there, because we are harm reduction based, we also like to do contingency management and MAT, which is medication for addiction treatment. So I like to throw out that we have a lot of options. We know that recovery is not a one-size-fits-all model, and we want to make sure that everyone kind of gets the care and consideration that they deserve. So thank you for your time.
Thank you so much. Jamie Farr. Jamie's still here? Bob Lester.
Good evening, members of the Human Service Commission. My name is Rob Lester. I'm here representing Men's Health Foundation. I came here to speak about our PrEP navigation program proposal and why West Hollywood support has never been more essential. For over a decade, MHF has been an integral part of the West Hollywood service provider network. Providing PrEP and PEP, these are the most powerful tools we have against HIV. These tools continue to evolve. We discussed earlier the recent release by Gilead of lenacapavir, which will be twice annual dosing. So more and more people are going to be able to access PrEP services. In our 2023-24 contract term, we screened 1,246 West Hollywood affiliated individuals and provided PrEP clinical services to 501 and PEP to 22 individuals. Our PrEP navigators provide comprehensive support, benefits navigation, case management. This ensures that our most vulnerable community members can access this life-saving prevention tool. Federal HIV prevention funding is facing unprecedented instability. Since January, the Department of Health and Human Services has disbanded the CDC Division of HIV Prevention, withheld funding and cut communications with awardees, partially rehired the HIV prevention staff, and partially restored funding. It's caused great harm and instability to the fight against HIV and organizations like MHF. And the future holds even more uncertainty because we really don't know what's going to happen next. We've been proud partners with West Hollywood since 2016 when you first started funding our PrEP program. Partnership has grown stronger each year because of the results you've seen that we've been able to provide. And now as federal funding wavers, your support is critical to maintaining services that prevent HIV infections and save lives. With that, we respectfully ask for your support.
Thank you so much.
Thank you for your stamina.
Next up is Paul Chavez. Paul, are you still here? Still interested in speaking?
I actually was going to kind of just give you a quick update just on kind of where we're at with our numbers right now. So our goal for the year is 10,000 Test My Drink kits. We're at about 23,000 right now. And that's another example of us being able to kind of use other funding sources to kind of continue our program, even if we run out of materials. We also have distributed 9,700 fentanyl testing kits, which we're not funded for right now, but it's kind of in kind. We work with our SIRS department and get those materials from them, as well as 742 Narcan doses. So just want to give you those numbers.
No, appreciate that.
Well,
Thank you.
Appreciate it.
Paul Dumont.
I believe I exceeded my time earlier, and I apologize for that. I thought that was public comment. I just wanted to add that the 5 beds that we requested on a fee-for-service model for community bridge housing was based on our experience this summer when Healthcare in Action gave our number to the WeHo care team, and they started calling us after hours, and they were putting people in our beds. And I looked back on it, and it was about 5 people on an average per night that we were housing from the city of West Hollywood. And I spoke with somebody in the city, and I said, man, I wish we could get paid for these beds. They said, oh, we have an RFP due in 2 days. So I spent the next 24 hours scrambling to put this together and submit it. And I was like, that's cool, maybe we can get some money. But if we don't, I promise we'll still have beds for you. We get people from Cedars-Sinai, from the Sheriff's Department, from County Departmental Health, from, again, the WeHo Care Team, Healthcare in Action, all the providers that you've been talking about, Tarzana Treatment Center. So we got those beds, we'll still have those beds, the money would help, but if you can't, that's cool too, we'll still give them a bed. Thanks.
Thank you, Paul. Treasurer Angleton? No? I hope I'm reading this right. Lula De Leyva?
Good afternoon, sorry, good evening. My name is Luca D'Oliva, and I'd like to speak on items 5A in support of defense all-in-one fentanyl testing device. Now, I have lost 2 friends from fentanyl poisoning during COVID, and they were not frequent drug users. One was actually 14 years old when he took a pill that he did not know was laced with fentanyl. Now, this affected the whole community, my friend's family, mourning over someone that should have, had a longer life. And this is why we need defense all-in-one tester. It is easy to use and not complicated like other testing devices. It even has a QR code feature on the back where it pinpoints where the fentanyl was detected. And this is very good for pinpointing where heavy fentanyl detection can be. And now I leave you with this. We cannot put a price on a life. We've all lost friends and family. How much would you spend to have just one more day with that person? Thank you.
Thank you, Luca. I'm so sorry for your loss. Tony Cruz? Jeffrey Rodriguez?
Hi, everyone. Thank you for all staying. Jeffrey Rodriguez, I'm from the LA LGBT Center Sexual Health and Education Program. And yes, as you're all aware, we did have to close our West Hollywood location. It's actually very hard for me to be up here to even say that out loud as someone who has worked for the center for over 15 years and opened up that location and then was at the spot previous. It is not a decision we took lightly with all the cuts, the federal cuts that we received. All of our funding from prevention ending in May 31st. The center continued to do services through June, and as we speak right now, are going through RIFs. So the reasoning for the extra money was in there was to kind of help with a little bit of that funding. loss. Also, with that being said, yes, DHSP, CDC funding did come through at very last minute within the last week or so. It is a quarter of the funding that we normally get. So I want to be very clear, we are still having to figure this out, and at any moment that can be ripped from us. So, and that funding only goes through December. So when we talk about a program like free HIV testing and free STD testing completely gone from a city like Los Angeles or a city like West Hollywood, those are the things I think we need to consider, you know, when we look at all of this. And I know there's a lot on the table for a lot of people, but that is really what we're talking about. Thank you.
Thank you, Jeffrey. Gina Bigham?
Greetings, and thank you for the time this evening. I'm grateful. My name is Gina Bigham. My pronouns are she, her. I am the program manager and one of the founders of the Trans Lounge program at the Los Angeles LGBT Center. A little history. We just celebrated our 10th anniversary this year. We have over 7,000 members. We run 20 groups a month. That's both virtual and in person, to approximately 300 community members each month, which over the course of the year would equate to close to 4,000 people a year that we reach to provide community support, empowerment, and community building. Trans Lounge has already approximately 250 gender-expansive folks who live here in the city of West Hollywood. With your funding, we will be able to expand that number and hopefully reach as many trans and non-binary folks as we possibly can. This would take place through social events, in-person and virtual support spaces, and creativity and wellness workshops. With our expanded reach into West Hollywood, we intend to build partnerships with city businesses and with other fine organizations, such as the West Hollywood Trans Advisory Board and others, to become more active in the community, and most importantly for me is to bring joy and what I like to call healthy distractions to a very scared and very anxious community. So I thank you for your time this evening.
Thank you. Shannon Houston.
Hello, good evening, Commissioners.
Just 1 minute, Shannon? Okay, now go ahead.
That wasn't you.
Good evening, Commissioners. Thank you so much for staying so late to hear our requests. My name is Shannon Houston. I serve as Director of Family and Child Care Provider Services for Pathways LA. We thank you for your continued partnership of over 35 years now. To answer a question that came up earlier tonight, we are fully ready and committed to expanding the services that we provide to the children of West Hollywood and surrounding communities. Once a larger space has been identified here in West Hollywood, our well-established relationship with community care licensing will help to expedite an expansion of our current license to provide more care to additional preschool children and infants and toddlers in this community. The addition of fee-based enrollment openings will also allow us to offer mixed delivery program, which will include middle-income families that are also in need of high-quality early child care. We do thank you for your continued support of West Hollywood families and your youngest community members, the children of West Hollywood. Thank you.
Thank you. The screens went black. I don't know if that's something we should be worried about. All right, next up is Siri Perlman.
Hi, good evening. I promise I'll be really quick. I was actually here at the last meeting when all of the other programs were coming up and just saying thank you and just wanting to introduce themselves, and I regretted not coming up. So really, that was honestly the point of my wanting to say good evening to you. And I also heard loud and clear how important the success stories are to you. And I have not been the best about putting that, so I will make sure that you have some client success stories for our seniors that receive our senior nutrition meals. And as you guys said, I mean, it's so important that we feed our seniors, and food insecurity is hugely important, but I'm so glad that you were talking today about social isolation. The communities that have been forming since we've come back from the pandemic have been so amazing to watch. Not only at our congregate sites, but also our home-delivered, isolated seniors at home. It means so much to them to have the regular driver come and check on them and that build that relationship. So thank you so much for emphasizing that tonight. And I did want to address a little bit of the concern of the duplication. So we also, since the pandemic now, have reinstituted our quarterly assessments. 2 of those are home assessments twice a year, and 2 are phone assessments. So we not only have a wellness check in place to see if we need to make other referrals or how they're doing at home, but it is also a way for us to evaluate if it's still appropriate for the individual to get that service at home, or if they should be transitioned to a congregate meal site, or what the needs are. So we really try to make sure that with there being a wait list, that if there is more space that we can make available, that we help the people that are most in need. And then, yeah, I also want to invite you at any point, if you want to come to any of our congregate meal sites and have a meal with us and engage with our participants, you're always welcome to, or a ride along with our home-delivered meals. We'd be happy to have you, and I think you would enjoy it. So thank you so much for your continued support, and you're all such wonderful partners, and thank you to staff for being such wonderful partners in this as well. Thank you. Have a good evening.
Thank you. Kevin Gordon? All right. We're good? All right, thank you. Michael McFadden? And that will be followed by Talia Boone.
That's my cue. That's my cue. Yeah, exactly. Do you need the screens?
I think as long as you see a timer, you're good to go.
I'll work,
Good evening. My name is Michael McFadden. I use he, they pronouns. I work at the LA LGBT Center in the Senior Services Department. Appreciate the marathon meeting tonight and your endurance in particular. There were some really incredible comments and some really thoughtful feedback on all the applications, so I just want to say thank you for the amount of time and energy you put into thinking these decisions through. It has a ridiculously enormous impact on the community and to the agencies themselves. We're seeing an increasingly growing aging population, and we're also actively seeing services to this community being cut, particularly at the federal level. So now more than ever, food insecurity is particularly important. And we see that our food programming as being a really wonderful entry point. We do a congregate meals, and which is a big chunk of the money that we've asked for in our proposal. Our senior lunches are an incredible opportunity for folks to come together, not only get a nutritious meal, but also to make some connections and also get connected to all the other services that we have, specifically case management, housing navigation, food pantry, and other meals assistance. We serve over 2,500 people each year, and for seniors, our age range is 50 and over, and we really want to make sure that we're engaging with folks early and often, particularly as the safety net it starts to feel a little bit thinner. We've returned each year and come back and wanted to say thank you for the funding that you've provided, but also to recognize that we've tried to adapt and so even though we're a returning funding department, we really tried to make sure that what we've proposed to you is really aligned with the needs that we see within our services in our department. And last but not least, I just want to say we view ourselves not only as grantees but as partners, and we've been really appreciative of the feedback that we've received from staff. Again, like the previous comment. Thank you. Have a great night.
Thank you, Michael. Talia Boone. Going. All right, next up is items from commissioners. Raise your hand if you have something.
Wait a minute.
I do.
Wait 1 second.
Yep.
Well, while they're doing that, I just want to, as a commissioner comment, I just want to say, Jewel Williams, please rest in power. And God bless you and thank you for everything.
And we do have one more public comment. Amy Gwen?
It's okay. All right. Hi, my name is Amy Nguyen. I'm with CAST, the Coalition to Abolish Slavery and Trafficking. Thank you all for being here. I really wanted to just kind of address the commission some of the questions about our mission and about our targets and numbers. CAST, we've been working in the LA area since 1995, serving both labor and sex trafficking survivors, people of all gender expressions, sexualities, race backgrounds across the Los Angeles area. And we've really focused on prevention and supportive services kind of throughout that time. I'm really sorry, Commissioner Palmieri, for whoever told you that there isn't trafficking in West Hollywood, because I'll go shake down that person. That is not true. But I'll say that with our population in particular, they're very transient, right? A lot of the survivors that we work with are exploited in multiple locations across the Los Angeles area, including West Hollywood. They are moving from couch to couch. They're moving in and out of housing. And so it has really been a challenge for us to answer that question around prevalence. And I think very few providers who are truthfully doing the work can answer that honestly. But I'll say that in terms of our targets and our numbers, we're really focusing on leveraging existing programs that we have and expanding outreach into the West Hollywood area. We offer an emergency shelter and transitional shelter, so those are 27 beds in total. We have a rental assistance program, legal services, and also comprehensive social services that are already in play, in-house. We have the staffing. We just really want to expand out into West Hollywood and work with many of the providers that are here and the community members here. And I'll just kind of share, finally, with the remaining time I have, that I think especially during this time where many of the community members that we're working with are facing a housing crisis, a drug epidemic, attack on their sexuality, on their identity. These are conditions that we know contribute to increased vulnerability to trafficking. And we would really love to partner with the City of West Hollywood to really provide leadership in this area and really take a public health approach to addressing this issue. So thank you.
Thank you, Amy. Thank you.
Thank you. We do have one more comment. I'm not too sure whether paper one. It was for Henrisa. No? No more public comments? Nothing else on Zoom?
It was your break note. I apologize. I did have that. Great. No items from commissioners, no? Commissioner Borelli.
The guy who's staying late, past my bedtime.
You did this to yourself.
I'm going to say, especially council members in the room, we have $17 million in requests and about $8 million to fit in this box. Maybe council will loosen up some more money. I don't know. Saying it out loud. If council members hear, they hear. I do want to say to folks, I think we were a little unfair to you by not putting in a 2-minute time limit early on in the program so that others could be heard fully first. So we apologize for that. This is my 4th rodeo and probably last. And we try to change it up every time because one time we had an 11-hour public hearing, so we won't ever do that again. So we apologize for changing that up a little bit. For the one area that we did not get a single proposal in our priority population was animals. Yeah. And that is a little disappointing to me, but I don't know what else we can do about that. That's it. I'll see you in 2 weeks.
Yes. I'd just like to add that we can potentially go back out for resolicitation if we have a proposal that we can send out to the community. If you have identified organizations that could potentially provide those services, we could potentially send it out to them. So there's options. We can look into it. It's not a closed deal.
There have been some that are interested, and they did try to get their RFP in. So we do have local vets and other organizations.
As long as we have 3 that we send it to, at least 3 to 5, we can make that happen.
And we can thank Renee and MJ for that.
Okay.
And what would be the deadline for that?
Well, we'd have to talk about that offline, yeah.
Yeah, are we saying we're going to add that to this program?
No, I'm just saying that it's not a, we could always try again.
Outside
in the future.
of this.
Correct.
Because everybody's put in the work for this
we're
funding.
not.
Okay.
Understood.
I'm not,
okay.
Yes.
I love
Not
that,
for
but
this
then
one,
also got
but
scared.
yes.
Okay, great.
I'm
And-
sorry, Chair. Before we move on, I just wanted to follow up on the record to Commissioner Borelli throwing me a curveball. I just pulled up the city's approved budget, and under the Human Services Division work plan, Road Aid Day programming is included. So I don't know what you were told, but the Paul Andrew Stark Warrior Awards will still be happening.
It was not in the city's events plan in the last budget that just went through the council.
Okay.
I read all of the events.
It's
So
in our division. I
It's
just
on
pulled
in
it
your
up.
division? Great.
Yes, it's in the
Very
division
much.
plan.
Had about 7 heads popping off in the coming months.
It would have been
I
8.
think Dee's head popped off when you said that. The only thing I'm going to say is thank you to all of you who are still sitting here with us and those of you who are watching at home. This is important. I know it's a long meeting, and I know that you're right, maybe we should have given 2 minutes, but we didn't. This is an important conversation. It happens every 3 years. Thank you to everyone that submitted a proposal. This is, wow. You all put a lot of very, very hard work into this, and you put a lot of passion into your work, and we read it and we felt it, and thank you. Really appreciate your patience this evening. I know you all thanked us, but you were the ones who sat here for 4 hours. So with that, we are going to adjourn. No, more.
Hi, Commissioner with a comment. Thank you. So I love the idea that we want to do some other things and have some other conversations about things that were brought up. There were plenty of other things that were brought up that folks didn't apply for. So I think future work of the body, great to have a conversation, but I also don't want to respond to this many community members versus this many who asked about this and grief services and all kinds. There's a lot of other feedback we got. So if we're going to do that, I think we should just evaluate that as a body before we make a decision on what to activate, right? I also have a process question. I just want to be super clear again about expectation for the 22nd. So the staff recommendations, when will this body receive that? When will we have the staff recos? Just so we know when we're looking at everything to review. Thank you.
The staff recommendations will be included in your packet that you will get. So we will meet and we will have our powwow so that we can get the packet together for you, and that will include what staff recommendations are, and then we will give a whole spiel before we present the item, letting you know how we came to those recommendations, all of the contributing factors, and then we will have that discussion, and it will be left up to you all to figure out if staff got it right, or if you want to reallocate and move funding around and play a game of Monopoly.
Yeah. I'm just going to lobby, and I know it's a lot, and I know it's a lot for you all to go through. It's going to be a lot for us all to go through, so I am just, as early as we can get it, because it's 43 proposals. We all know what it is at this point, but it's 43 proposals. It's a lot of money, and we've got a lot of chess to play. So I appreciate you all. I know you've got 10,000 other things on your plate, but as early as we can get that, I would be super duper grateful.
We're meeting on the 15th, and so
Gorgeous.
shortly thereafter you should get it. Yeah.
Okay, thanks.
Thank you. Any other comments? Okay, so with that, we will be adjourning tonight in honor of Jewel Tice Williams and Sandy Hutchins. Thank you all so much.